The committee will now come to order. Good morning to everyone. The purpose of this hearing is to examine how state policies, like those in Missouri, are impacting residents' access to comprehensive reproductive health care services, including abortion. Without objection, the chair is authorized to declare a recess of the committee at any time. For audience purposes, we welcome you and respect your interest in being here. In turn, we request and we ask you to respect the proceedings as we go forward in today's hearings. With that, I will now recognize myself to give an opening statement. I would like to begin by acknowledging that this is the first full committee hearing we have held since our friend, our colleague, and our beloved chairman, Elijah Cummings, passed away. Chairman Cummings spent his entire life fighting for justice and equality for everyone, and he was a fierce champion for women's access to health care. Across the country, extreme forces in some state governments are taking draconian steps to violate women's rights by restricting access to reproductive health services, including abortion. These state actions include prerequisite undue burdens, restrictions, and outrageously invasive procedures for patients seeking abortions. Let me be clear about what these restrictions are. They are a denial of basic health care services that women have a right to receive, no matter where they live. I want to thank my very good friend, Congressman Clay, for his leadership in requesting today's hearing. Missouri has taken some of the most extreme actions to limit access to reproductive health care. Missouri is one of 6 states with only one remaining abortion provider, and as we will hear today, it is at risk of having no providers at all. Missouri's one remaining clinic is Planned Parenthood, and we thank that clinic's director, Dr. McNicholas, for testifying here today and for her brave service to the women in her community every single day. Earlier this year, Dr. Randall Williams, the director of the Missouri State Health Department, ordered Planned Parenthood to perform medically unnecessary pelvic examinations on every single woman seeking an abortion. This was an invasive, state-sponsored abuse of women seeking care. After significant public backlash, the state suspended this cruel practice. But Dr. Williams also recently was forced to admit that he directed state employees to collect information about patients' menstrual cycles to advance his ideological crusade. That is what they were spending taxpayers' dollars on. I cannot begin to describe my disgust at these violations of privacy and breaches of trust by government officials. Sadly, Missouri's actions are not taking place in isolation. Other states have pushed for similar restrictions. I believe these states have been emboldened by the Trump administration's systemic attacks on reproductive health care and general disrespect for women. In 2012, our former chairman, Darrell Issa, held a hearing in this room, in this committee, with an all-male panel of religious leaders who were trying to take away contraceptive coverage for women. They did not invite one single woman to testify on that panel. Then they refused our request to have Sandra Fluke, who was a Georgetown Law School student at the time, testify about the importance of health insurance coverage of contraceptives. They said she was, and I quote, "not qualified," end quote. It was at that hearing that I asked in protest, where are the women? It is time to let women speak, and it is time for everyone to listen. It is time for elected representatives here in Congress and in state houses across the country to protect the right to privacy and a woman's right to abortion services rather than attack it, undermine it, and try to eliminate it. I want to thank Jennifer Box for sharing her family's story with us. No one should ever have to make the heartbreaking decision that you and your husband had to make. But it is your decision, and it does not belong to anyone else. I also want to thank Marcella Howell from In Our Own Voice, which is part of the National Black Women's Reproductive Justice Agenda, and Fatima Ghost-Graves from the Women's National Law Center for all her work and for being here today, and for helping the committee and me on this subject. I now recognize the ranking member, Jordan, for his opening statement, and I yield back.
Thank you, Madam Chair. I want to thank our witnesses for being here today. In the Declaration of Independence, signed 243 years ago, our founding fathers enshrined the principle that life, liberty, and the pursuit of happiness are inalienable rights for everyone. I think it's always interesting to note the order the founders placed the rights they chose to mention. Can you really pursue happiness? Can you chase down your goals and dreams if you first don't have freedom, if you first don't have liberty? And do you ever enjoy true liberty, true freedom, if government won't protect your most fundamental right, your right to live, your right to life? Life is precious. It's a sacred gift from God. During an earlier time here in Congress, whatever disagreements that we had, colleagues who didn't share those beliefs, there was a common understanding about this fundamental principle, that life, in fact, is precious. Over the past few years, it seems our two sides have moved away from this basic understanding. Today, my colleagues on the other side of the aisle will charge me and Republicans as being against women. Democrats will say, if you're not for them in this position and their position on this issue, then you're against all women. We want all people, including women and babies, to have access to world-class health care. Statements to the contrary are simply false and are meant to divide our country. Today, this Congress is in the midst of an unprecedented impeachment inquiry against President Trump. I am proud that President Trump is one of the most pro-life presidents to ever lead our nation. President Trump has taken bold steps to stop federal funding of abortions and enable better legal protections for health care workers who are opposed to providing, assisting, or participating in these procedures. The hearing today is an attack on that pro-life record. Today's culture, standing for life, it's not easy. But I'm always guided by one of my favorite scripture verses, 2 Timothy 4:7. Fight the good fight, finish the course, keep the faith. And that's what we have to do, keep the faith in those basic principles outlined in that document that started our nation over 200 years ago. We came to this Congress to fight for the right of all Americans to have life, liberty, and pursue happiness. I yield back.
I will now yield 1 minute to the member from the great state of Missouri, Lacey Clay, who requested this hearing.
Thank you, Madam Chairwoman. I, along with my constituents, appreciate your calling this hearing today on an urgent issue that threatens the health and personal freedom of millions of American women. The assault against a woman's right to make their own health care decisions is an insult to the basic values of individual freedom and limited government. Nowhere in the nation is that assault more urgent than in my home state of Missouri, specifically in the city of St. Louis, which I am so proud to represent. Planned Parenthood of St. Louis is the last remaining women's health care clinic in the entire state of Missouri that also provides abortion services. I visited the clinic staff and physicians this past June as the battle was elevating, and I wanted to lend my support and voice to their efforts. As a husband, father, and brother, I support and trust the private, personal health choices of women. I am truly amazed that the Missouri Department of Health would, along with efforts to shut down the clinic, intimidate patients and threaten providers, and would allegedly and bizarrely track women's menstrual periods on spreadsheets to determine if they had had an abortion. No woman should be subjected to this violation of their personhood. This is America. It's her body, it's her health care, and it's her decision. I stand with Planned Parenthood because they are truly on the front lines of defending women's health care across America. Madam Chairwoman, I would also like to introduce into the record a personal statement by Ms. Meavy Mead, the Director of Policy and Organizing of Planned Parenthood Advocates in Missouri.
Without objection, so ordered.
Thank you. I yield back.
And I will now yield time to the member from great state of North Carolina, Dr. Fox.
Thank you, Chairwoman Maloney. I welcome you to your first hearing as acting chairwoman and look forward to continuing working together in your new role. We've had a productive working relationship over the years, and I commit to continuing in that spirit. I want to say that my sympathy goes out to any woman who feels she must seek an abortion. It must be a horrible situation to be in. But I will admit that I am perplexed by the scope of the hearing. After all, my colleagues on the other side are quick to assert that Roe v. Wade is, quote, the law of the land. However, Planned Parenthood v. Casey clearly allows states to implement abortion restrictions, even ones that apply during the first trimester of pregnancy. States are grappling with issues of how to defend and preserve life and support high standards for women's health care. As states continue to explore ways to do so in recent years, we are now at a reflection point. After the governor of Virginia's horrific comments earlier this year, there's been a national outcry over the apathy shown by the pro-abortion movement towards babies that have been born after an abortion. This is an issue that's very close to my heart and the hearts of millions of Americans. I'm going to quote the governor. If a mother's in labor, I can tell you exactly what would happen. The infant would be delivered. The infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mother, end quote. Governor Northam, unfortunately, does not stand alone in this appalling stance. He echoes a Planned Parenthood's lobbyist who, during testimony on Florida's Born Alive bill, expressed support for leaving an abortion survivor on the table to die, if that is what the patient and abortionist decided. In New York, the Reproductive Health Act, signed into law by Governor Andrew Cuomo, removes protections for children born alive during abortion attempts, leaving them at the mercy of the abortionist who just minutes earlier was trying to kill them. Illinois has also enacted a law that repealed the Illinois Partial Birth Abortion Ban Act and removes licensing requirements for abortion facilities. Still, other states, notably Massachusetts and Virginia, having proposed legislation that is equally as alarming. Only 2/3 of the states have any laws to protect infants who survive abortion and that positively enshrine their right to life into law. That's simply unacceptable. Madam Chairwoman, respectfully, in light of these events, I hardly find that anyone is losing access to anyone save the defenseless, the unborn. The unborn and now even born alive. They are the ones having their rights deprived, and the American people find this intolerable. I find it to be an abomination. The pendulum in the states is not one that's swinging against women, not in the slightest. Some of my colleagues used to espouse the idea that abortion should be safe, legal, and rare. They espouse it no longer. Instead, on-demand access to abortion up to and tragically even after birth is the new mantra. And the fact that extremists are working to keep this ever-expanding restriction on the right to life buttressed against the lives of babies born outside the womb, there should be a wake-up call to us all. I call on Speaker Pelosi to end her blockade against the bipartisan Born Alive Survivors Protection Act. This bill would protect babies born alive in the remaining 1/3 of state jurisdictions that fail to do so. Life is sacred, and the regard with which we hold it is what defines who we are as a society. We live in a society that mistakes choice for liberty and denies the dignity of unborn life. But the beauty of living in a free country is that we can use our liberty for love. We must put love into action every day, affirming the value of life at all stages, no matter the difficulties it presents. Striving to love daily is not easy, yet it is the greatest exercise of our freedom, and there's no life unworthy of that love. I yield back, Madam Chairman. Thank you.
I will now briefly yield to Congressman Clay to introduce his constituent, Dr. McNicholas.
Thank you, Madam Chair, and I'm happy to introduce to the committee one of my distinguished constituents, a highly skilled physician who has dedicated her life to providing exceptional health care for all women. The Chief Medical Officer of Planned Parenthood of the St. Louis region in Southwest Missouri, Dr. Colleen McNicholas. Dr. McNicholas has also served as a distinguished assistant professor of obstetrics and gynecology at Washington University of Medicine in St. Louis, and Dr. McNicholas is also a champion for closing healthcare disparities like high maternal and infant mortality rates that affect minority and low-income patients most because of a lack of access to basic medical care. Dr. McNicholas performs her duties with skill and compassion. She is a compassionate healer who fiercely defends her patients' rights and their privacy as well. Dr. McNicholas is a warrior for access to quality health care for women, not just in St. Louis, but across Missouri and across the nation as well. Welcome, Doctor. Now yield back.
Thank you, Congressman. We are also joined by Jennifer Box from St. Louis, Missouri, and she was holding that beautiful baby girl. Yeah. And also we're joined with Fatima Goss Graves, President and Chief Executive Officer of the National Women's Law Center, and Ali Stuckley from Carrollton, Texas, and Marcella Howell, Founder and President, Chief Executive Officer in Our Own Voice, National Black Women's Reproductive Justice Agenda. If you would all please rise and raise your right hand, I will begin to swear you in. And raise your right hand. Do you swear to affirm that the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God? Let the record show that the witnesses answered in the affirmative. Thank you, and please be seated. The microphones are sensitive, so please speak directly into them without objection. Your written statement will be made part of the record, and with that, Ms. Box, you are now recognized for your opening statement.
Good afternoon, Acting Chairwoman Maloney, Ranking Member Jordan, and members of this committee. My name is Jennifer Box. I'm a mother of 3 living children, and as you saw, I am here today with my 3-month-old Astrid and my husband, Jake. I'm a small business owner, a wife, and a Missourian. I am here today to tell you the story of our daughter, Libby. I am also here to share with you, as someone who was in need of an abortion, how difficult my home state of Missouri makes it for pregnant people to access abortion. Libby's story is heartbreakingly linked with the political landscape in Missouri, something I never imagined I would have to navigate when learning the most devastating news of our life. It was almost in the same breath that I learned that my pregnancy had a fatal fetal diagnosis that I learned my home state of Missouri would insert itself in the middle of my grief. I searched for answers everywhere, and yet we found no solace in them. Our daughter, if not stillborn, would be born into a life of immediate and repeated invasive medical intervention. She would essentially have been born onto life support. With broken hearts, we knew that the greatest act of love that we could undertake as her parents would be to suffer ourselves instead, to end the pregnancy, grant Libby peace, and spare her tiny, broken body a short life full of pain. We had made our decision and were still grappling with the reality of it, but there was little time to spare. Missourians like me who seek abortion are confronted with a litany of onerous restrictions, including mandatory waiting periods, private and public insurance bans, informed consent laws, and more. This means that I moved at the direction of the government. For example, my doctor's Catholic hospital, where I delivered my 2 older children, refused me care. We had to pay thousands of dollars out of pocket because of the state's insurance bans against abortion coverage. And perhaps most surprising, our procedure was rushed due to the state's consent and mandatory delay laws. Despite how difficult it was to access the medical care I needed, my actual abortion procedure was the most compassionate care I have ever received from a physician. Jake and I left that day knowing that we had made the most loving and merciful choice for our daughter. I thought after the procedure was over, my family could begin to heal privately. I never imagined watching the State of the Union and hearing the president refer to women like me, women who have had abortions later in pregnancy, as murderers. I never fathomed my governor would weaponize the health department in an attempt to end safe, legal abortion in Missouri. I did not anticipate that my state legislature would enact an 8-week abortion ban, a ban that would have made it impossible for me to make the best decision for our family. And let me be clear, my story does not give anyone the right to make judgments about good reasons and bad reasons for abortion. A fetal diagnosis was my reason, but nobody should have to explain themselves or compare their stories to justify a deeply personal decision. I tell my story knowing I'm a woman of privilege with means and resources to access the care I needed despite a complicated landscape of laws. Every day, women and people of color who face racist and discriminatory policies carry the heaviest burdens when navigating abortion access. Politicians like Governor Parson are hell-bent on finishing off what little remains of the reproductive health care in my state. Members of Congress, I urge you to remember who you represent. I am the 1 in 4 women who will have an abortion in her lifetime. You have the power to change a broken system working against us, and I ask that you work in our best interests. I'm not asking you to condone my choice. I'm simply begging lawmakers like you who have the power to create change to allow families to make that choice for themselves. I speak for Libby. It is an honor to share her name with this committee and the country today. Libby Rose Box. I have a rose tattoo above my heart so that she is with me every day. I am her mother, and she is my daughter and will always be my daughter. I made decisions from day one as her mother, and I made the most important decision of Libby's life when together with my husband, we decided to terminate the pregnancy. It was a sacred, painful, personal decision. That is our story, unique to our family, and one that never should have included any politicians. Thank you for your time.
And thank you for sharing your story. I'll now call upon Dr. Colleen McNicholas.
Thank you, Acting Chairwoman Maloney, Ranking Member Jordan, and members of the committee. Special thanks to Representative Clay for that very kind introduction. My name is Dr. Colleen McNicholas, and I'm a practicing OBGYN in the state of Missouri. And as you heard, I'm the Chief Medical Officer of Planned Parenthood of the St. Louis region and Southwest Missouri. For more than a decade, I have been honored with the trust of patients seeking a broad spectrum of reproductive health care services, including abortion. As you may know, there is only one health center left in Missouri that provides abortion to meet the needs of more than 1.1 million women of reproductive age in my state, Planned Parenthood's Reproductive Health Services in St. Louis. I'm here today because if Governor Parson and Health Director Williams get their way, Missouri could soon become the first state since Roe v. Wade without a single health center that provides abortion care. I want to tell you how we got here and the dangers that we face when state officials abuse their power and disregard patients' lives to pursue a political agenda. Despite the reality that abortion is safe, Missouri politicians have layered restriction upon restriction, ranging from long waiting periods to insurance coverage bans in a deliberate attempt to end abortion access. Over the last 30 years, Missouri has gone from nearly 30 clinics to just 1 clinic today. Earlier this year, Governor Parson signed one of the most restrictive abortion bans in the country, banning abortion as early as 8 weeks and altogether if Roe were overruled. Fortunately, that ban, for now, is blocked in the courts. Unable to get the job done through legislation, though, Parsons' administration weaponized the licensure process to deny our abortion facility license. Health officials admitted under oath that they singled out Planned Parenthood for extra inspections, additional scrutiny, including at the behest of anti-abortion protesters and legislators. They came to our clinic 5 times in the first 5 months of this year, all while they conceded that hospitals and surgery centers providing much riskier procedures went years without a single inspection. During this year's inspection process, the department also admitted to keeping a spreadsheet of my patients' menstrual cycles. A brazen abuse of power and misuse of data motivated by an agenda to find something, anything that they could use to justify further scrutiny. As shocking as that sounds, more egregious was Director Williams' reinterpretation of a 1988 regulation which forced over 100 patients to undergo multiple invasive pelvic exams. My colleagues and I could not, in good conscience, force patients to take their clothes off unnecessarily and endure an extra state-mandated vaginal exam. Due to public outcry, the department relented, but that only confirms that there was no real medical reason for that exam. Missourians want to believe that state officials charged with protecting public health have their best interest in mind. They want to trust that when they go to the doctor, their private medical information will not be mined by the Department of Health as part of a political fishing expedition. Governor Parson and Director Williams have repeatedly violated the trust of our community and compromised my patients' safety, all to push a political agenda. And it's not just Missouri. Anti-abortion politicians in other states, including Louisiana, refuse to license abortion facilities simply because they do not agree with the health care that is provided there. This year alone, 12 states have enacted 25 different abortion bans, and that is on top of the nearly 500 abortion restrictions enacted in the states since 2011. This obsession with abortion has not only proven detrimental to our patients, but it has lasting effects on the health of an entire community. While Missouri goes to incredible lengths to ban abortion, maternal mortality is rising, and Black women are dying in pregnancy at 3 times the rate of white women. Despite this and many other serious public health crises, anti-abortion politicians continue to divert precious resources to the overregulation and targeting of abortion providers. In Missouri, I'm happy to say that despite the unrelenting attacks on reproductive health care, our doors remain open, for now. Planned Parenthood will continue the work of ensuring that every patient who needs and wants an abortion is able to access that care with dignity and respect and consistent with their values in spite of this impossible landscape. In my exam room, abortion is not political. It's simply health care. And it's time we listen to the majority of Americans and put an end to this rampant abuse of power and do what is necessary to keep abortion safe, legal, and accessible. Thank you.
Thank you for your work and for your testimony today. I am now going to recognize Fatima Goss Graves.
Thank you, Acting Chairwoman Maloney and Ranking Member Jordan and members of the committee. Thank you for the invitation to testify today, and especially on this first hearing following Congressman Cummings' passing. He was a champion for justice and on these issues. My name is Fatima Goss Graves. I'm President and CEO at the National Women's Law Center. At the Law Center, we know that access to reproductive health care, including abortion, is vital to gender justice. Access to abortion is a key part of a person's liberty and equality and economic security, and everyone, no matter where they live, no matter their financial means, should have access to abortion when they need it. As the Supreme Court said in Planned Parenthood versus Casey, the ability of women to participate equally in the economic and social life of this nation has been facilitated by their ability to control their reproductive lives. We also know that legislators passing restrictions on abortion want to control the lives and futures of women. And it's not lost on me that we're facing the biggest threat to the right to abortion on the eve of the 100th anniversary of the 19th Amendment, when some women first gained the right to vote. The fight to secure the vote was symbolic of a broader societal change regarding women's ability and right to be politically equal and make politically independent decisions. And now, too, there is a broader movement in this country that will transform the relationship between gender and power. And it is against this backdrop that we must view Missouri's regulatory and legislative efforts to shut down the state's last abortion clinic. Missouri is not the only or even the first state to seek to end abortion in this country, of course, but what is unique in this moment are the types of abortion bills that are being introduced and passed. Before this year, bans on abortion that represent a direct challenge to Roe, for example, banning abortion 2 weeks after a missed period, before most people would even know that they are pregnant, were typically seen as too radical, even by many anti-abortion advocates. And what is also unique to this moment is state legislators' willingness to express upfront why they are pushing these extreme measures. Their goal is to propel a case that presents the Supreme Court an opportunity to overturn or to grossly undermine Roe versus Wade. These legislators believe that between President Trump and Vice President Pence and the newly constituted Supreme Court, that their goal will be realized. And during his first campaign, President Trump even promised some form of punishment for women who have abortions, and that he would automatically overturn Roe versus Wade. And in the 3 years that Trump has been in power, he has reshaped our federal judiciary in shocking terms to fulfill that promise. It is disturbing, then, that earlier this year, the Fifth Circuit upheld a Louisiana law that is identical to a Texas law struck down by the Supreme Court in Whole Women's Health versus Hellerstedt in 2016. The Supreme Court has just agreed to review this rogue decision this term in June Medical Services versus Gee. This should be an easy decision. Nothing relevant has changed in the last 3 years except for the composition of the Supreme Court. But the law at issue in June also does nothing to make abortion, an already extremely safe procedure, safer. Instead, such laws are intended to close clinics, and they have done just that. The resulting shortage of abortion providers has led to longer waiting times for appointments, increased travel to clinics, which often result in increased costs, long-distance travel, hotel stays in different cities, additional child care expenses, more time off work when people don't have it, and ultimately delays in getting the care that they are seeking. These costs compound the other restrictions that are already in place, including restrictions on insurance coverage of abortion, all intended to make abortion unaffordable and therefore inaccessible. And what these politicians are doing is not representative of the will of the people. The public doesn't want the right to abortion overturned. In fact, in the wake of these extreme abortion bans, the public sentiment showed its strength as people flooded the streets this past summer to protest these laws on the middle of the week. As president of an organization that fights for gender justice in our schools, in work, in healthcare, and improving income security for women and their families, I have a bird's eye view of how all of these fights are connected. The same misogyny that is driving these abortion bans drives much of the opposition that we are seeing in other gender justice battles. That's why at this moment of reckoning on the constitutional right to abortion, we need Congress to lead. We think they can start with passing laws such as the Each Woman Act and the Women's Health Protection Act. Thank you.
Thank you so much. Allie Stuckey.
I'd like to thank Chairwoman Maloney and Ranking Member Jordan and the rest of the committee for the opportunity to appear before the committee today. My name is Allie Stuckey. I am an author, a podcast host, a commentator, a wife, and a mom. I've spent the last few years studying the pro-abortion movement, observing the growing radicalism of the abortion agenda, and speaking out about the injustice occurring on the state and federal levels against preborn children and their mothers. I am here today as a mom fighting for a future for her kids in which rights are not dependent on whether a person is wanted, but upon their humanity. I am here as a woman who believes that female empowerment, equality, and freedom are not defined by her ability to terminate the life of her child. I'm here as an American afraid for the fate of a country that no longer considers the right to life a prerequisite to liberty or the pursuit of happiness. I'm here as a human being, horrified by the violence, the oppression, and the marginalization of a defenseless people group based solely on where they reside, in the womb. It's surreal to be here, and not because I'm testifying before Congress, but because of the subject at hand. It is incomprehensible to me that we are having a debate over whether or not it is acceptable to kill a baby before they're born. And while we discuss Democrats' concerns about abortion restrictions today, I want to remind the committee of the true victims of radical legislation, and that is preborn babies. There was a time, perhaps, when we could claim ignorance as our justification for allowing and approving of abortion. Only a few decades ago, we knew relatively little about preborn babies in early stages of development. It seemed appropriate to some to deem abortion a privacy issue or an issue of bodily autonomy. And even then, the motto was safe, legal, and rare. Pro-abortion advocates have abandoned these three qualifications in favor of on-demand through all 9 months for any reason. Barbaric laws like those of New York, Illinois, and a bill in Virginia aim to codify what Roe and its companion cases allow, the virtually unrestricted access to abortion until the point of birth. As its defendants' position on abortion has radicalized, science and technology have advanced. We now know that a baby's heart begins to beat as early as 6 weeks. The child can feel pain as early as 20 weeks, only halfway through the pregnancy. Babies born as early as 21 weeks gestation have survived outside of the womb. By 24 weeks, still only in the second trimester, a fetus has a significant probability of surviving if born premature. Babies at this age have also received life-saving procedures to treat diseases like spina bifida. Any woman who has been pregnant or has seen her child on an ultrasound knows the undeniable humanity of their preborn babies. Even as someone who is pro-life, I was shocked to see my daughter in the womb at just 11 and a half weeks, kicking, punching, flipping around. 11 and a half weeks is still the first trimester. Embryology tells us that at the moment of conception onward, a baby is a living human being with a distinct DNA, and yet the abortion advocates have doubled down on their dehumanizing rhetoric and legislative efforts. Remarkably, many members of the so-called Party of Science insist upon referring to preborn children as no more than clumps of cells. And speaking of abortion, its defenders ignore the existence of the child entirely. Terms like reproductive freedom or bodily autonomy, women's empowerment are used as euphemisms to obscure the reality that the life inside the mom's body is a human, a baby, her baby. If abortion were truly a winning issue for women, if it were, as an article in New York Magazine recently argued, a moral good, this kind of deception wouldn't be necessary. But abortion advocates know that using accurate terminology to describe abortion is an effective PR, and therefore it doesn't make for a profitable business model. Late-term abortions are typically performed, of course, by emptying the uterus of amniotic fluid, then dismembering the baby with forceps. There are other cases of more grotesque methods utilized, like with Kermit Gosnell. Witnesses before Congress have testified to the neglect of babies who survive abortions, many of whom are reportedly left to die alone. Virginia Governor Ralph Northam declared earlier this year that a baby who survives an abortion would be delivered, kept comfortable, and resuscitated if that's what the mother and the family desired. While tragic, pro-lifers shouldn't be surprised by pro-choice radicalism. This is the end of the logic of the pro-abortion case. There is no logical argument for abortion that doesn't also apply to people who are born. America is included on a list of only 7 countries, including China and North Korea, to allow abortion after 20 weeks gestation. The same legislators who are pro-abortion were happy to vote yes on a bill criminalizing animal cruelty on the federal level. And while I'm thankful for this, I only wish the same basic compassion could be extended to the most vulnerable members of our own species. Thank you.
Thank you very much. And Marcella Howell.
Acting Chairwoman Maloney, Ranking Member Jordan, and honorable members of the committee, thank you for the opportunity to testify at today's hearing. I would like to take a moment first to mourn the passing of Chairman Cummings, a fearless champion of human and civil rights. We promise to pick up his mantle and continue his fight for universal justice. I am Marcella Howell, founder and president of In Our Own Voice, National Black Women's Reproductive Justice Agenda, a national state partnership with 8 Black women's reproductive justice organizations. Black Women for Wellness, Black Women's Health Imperative, New Voices for Reproductive Justice, Sister Love, Sister Reach, Spark Reproductive Justice Now, the AFIA Center, and Women with a Vision. Reproductive justice is the human right to control our bodies, our sexuality, our gender, our work, and our reproduction. That right can only be achieved when all people have the complete economic, social, political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. This includes the right to choose if, when, and how to start a family. When it comes to abortion, we focus specifically on access rather than rights, asserting that the legal right to abortion is meaningless for pregnant people when they cannot access such care due to the cost, the distance to the nearest provider, or other obstacles. Across the country, we are faced with the ever-complicated wave of abortion restrictions that continue to compound already existing barriers, making access to quality abortion care a privilege for the few rather than a human right for all. After the 1973 landmark Roe v. Wade decision, the Supreme Court victory was immediately undermined and invalidated for people with low incomes with the passage of the Hyde Amendment. As the Guttmacher Institute notes, because of social and economic inequality linked to systemic racism and discrimination, women of color are disproportionately likely to be insured through Medicaid, therefore subject to the Hyde Amendment's cruel ban on insurance coverage of abortion. The decision of when and how to have a family, or when to start or grow a family, is a decision that should be made by a pregnant person and those they trust, not politicians. Over the last decade, abortion access in the U.S. has become increasingly fraught with restrictive laws. Such abortion restrictions include everything from parental consent laws for individuals under 18, often coercive mandated counseling, mandated waiting periods, and unnecessary and burdensome regulations on providers and clinics. This web of restrictions and bans has ultimately created an unjust landscape. As the country grapples with a maternal mortality crisis, one that disproportionately impacts Black women, research has found that the states with the higher numbers of abortion restrictions are the exact same states that have poorer maternal health outcomes. That is not a coincidence. Reproductive justice is economic justice. One reason people choose to have abortions is because of the significant expense of having and raising another child, given that many are already parents. We cannot afford to endure another abortion ban because we are already battling discrimination in health care, wages too low to put food on the table, debilitating child care costs, attacks on immigrants, and threats to our voting rights. These issues cannot be separated or siloed. Together, they are an attack on our ability to live with full agency over our lives and to raise our children with dignity. I thank the committee for its dedication to addressing these issues through a lens of justice and equity, and centering the valued lived experiences of marginalized communities, including Black, Latinx, Asian American Pacific Islanders, and Native and Indigenous women, transgender and gender non-binary people, LGBTQ people, people with low income, people in rural communities, those with disabilities, youth, and immigrants. I explicitly name us all because all of our struggles are tied together, and many of us live at the margins of multiple oppressed identities. I urge the committee to address these abortion restrictions with urgency as we collectively work toward bodily autonomy and a world where full reproductive justice can be actualized. Thank you.
Thank you. I want to thank all of the panelists for your important testimony. Without objection, the following members are authorized to participate in today's hearing: Congresswoman Chu, Congresswoman Schakowsky, Congresswoman Schreier, and Congresswoman Lee. I will now call on Lacy Clay to begin the questioning. He is the originator of this hearing.
Madam Chairwoman, let me thank you again for convening this hearing. to call attention to the intrusive restrictions that are threatening the health and well-being of thousands of women in my congressional district and home state. In Missouri, we're down to one last abortion clinic. State health officials are doing everything in their power to try to shut that clinic down. They are trying to regulate Missouri's last clinic out of existence by imposing rules and regulations that are medically unnecessary, overtly intrusive, or virtually impossible for any healthcare provider to comply with. And as you heard Dr. McNicholas explain, the health department began enforcing a medically unnecessary requirement that women submit to an additional pelvic exam 3 days before being allowed to have an abortion. Dr. McNicholas, as a physician, is there any medical reason for such a requirement?
Thank you for the question, Representative Clay. So as I previously stated, and I think you noted as well, forcing women to undergo medically unnecessary pelvic exams shows clear disregard for the potential traumatic impact that that has. We're talking about a country where every 73 seconds an American is victimized with sexual assault, and that rate is 12 times higher for women with intellectual disabilities. Within days of having to comply with that mandate, we saw a patient, a minor, accompanied by her mom, who was a victim of sexual assault, who had never had a pelvic exam before, who didn't even know what her parts were. And as a reminder for those of you who have never had a pelvic exam in this room, that means putting your fingers inside someone's vagina, forcing somebody, this minor, never having had a pelvic exam, to have that invasive procedure when there was absolutely no medically relevant reason to do so was traumatic for her mother, and for the physician who was required to do it.
How did that make you and your staff feel?
So I can tell you that in the times when we had to comply with this regulation, I'm not sure who cried more, the physicians, the staff, the patients. We had patients apologizing to us that we were forced to do this to them. Our patients are accustomed to jumping through hoop after hoop to get an abortion. So when told they had to do this too, they were resigned to the fact that that was just part of the deal. But it was traumatic for everyone.
And if that wasn't outrageous enough, just weeks ago we learned that the state staff were ordered to keep a spreadsheet tracking the menstrual cycles of women who visited St. Louis's Planned Parenthood clinic. Doctor, do you find the practice of tracking the dates of patients' periods problematic?
I find it bizarre and a complete violation of the trust that the community puts in the public health department and the trust that our patients put in us. It was clearly part of an orchestrated attack on Planned Parenthood and really demonstrates an abuse of power and misuse of data.
And what do you make of the fact that a trained physician has imposed these medically unnecessary and intrusive requirements on providers and patients?
So it's shocking that our Department of Health is headed by a physician, Dr. Randall Williams, and more shocking is that he is an OBGYN. He knows better, but instead of relying on the medical ethics that he was taught and the many patient experiences that he's had over the course of his career, he instead decided that his job was to act at the behest of a politician to end abortion as part of a political agenda and forgetting what it's like to treat patients.
What would it mean for patients in Missouri if your clinic closes?
You know, the consequence of that is there are so many consequences to that. Certainly, people will be forced to carry pregnancies that they can't and shouldn't and don't want to, continuing the cycle of poverty for some. Many will be forced to travel long distances, expending resources they already don't have to access that care. and people will have really lost the trust that they have in the state of Missouri, who would then have abdicated its responsibility to providing very basic health care.
I thank you for your response, and I thank the entire panel for being here today. And Madam Chair, I yield back.
I'll now recognize Clay Roy, Representative Roy.
I'll take the name Clay. It's all right, Ms. Price.
Okay.
Thank you, Madam Chairwoman. In 2015, I got a call from a young woman who is one of my dearest friends. She's like a little sister to me. She said that the baby that was in her belly, her third, might be missing part of his brain, the part that connects the left and right hemispheres. She was terrified and couldn't ask questions fast enough. She had a monthly checkup with her OB-GYN the following week. Her husband had to work, but she took her 2 boys with her. They liked going to hear the baby's heartbeat, and the checkups were usually routine and quick. She went into the appointment expecting her doctor would reassure her, and her answer reviewed the file. Then the doctor looked our friend straight in the eye and asked her if she wanted to terminate the pregnancy. She called us right after that appointment, understandably angry and terrified. Terminate? What? She explained that the doctor had asked her the question in the same tone she might have used when ordering coffee at Starbucks. She didn't blink an eye. She asked it in front of her 2 little boys. She asked without her husband there. She offered no explanation or comfort. It was cold. The doctor told her she had to decide quickly because she was approaching 22 weeks, which is as long as you can legally wait to have an abortion in Virginia. Our friend's response was such a source of pride for us. She told us she almost laughed and then politely responded that termination was not an option. She walked out of that doctor's office and never returned. So how did it all turn out? Her ultrasound was completely normal at 24 weeks. They just couldn't get a good read at her 20-week appointment. Her baby was born in May of 2015 and is completely healthy. It was a boy, by the way. None of us, but particularly his loving and courageous mother, can imagine life without him. He is my godson. In the winter of 1996, a couple went in for a checkup. They were excited. They had recently been informed they had twins. The doctor came in and performed more tests. Time passed by and the doctor returned. The doctor seemed concerned, as they believed the twins had cystic fibrosis. If they were born, they would only survive for a few hours, they were told, if that. I recommend termination, said the doctor. The couple said the first thing that came into their mind, no, and walked out. They chose life. Those twins would grow up to become excellent men. I know this because Jonah works for me, right here. He's one of my staffers. Ms. Stuckey, Planned Parenthood is not about health care, it's about abortion, no?
Yes.
Planned Parenthood took in $1.67 billion in total revenues, a 14% increase over the year before. Private donations totaled $630 million. Does that sound right to you?
Yes.
Government funded amounted to $563 million of that amount. Does that sound right to you?
Yes.
Planned Parenthood received nearly $60 million annually under Title X, under the Protect Life Rule, which ensures the compliance with statutory prohibition against using Title X funds for programs where abortion is a method of family planning. In August 2019, Planned Parenthood confirmed they would withdraw from Title X funding rather than comply with the new rule. Does that sound right to you?
Yes.
Do we need Planned Parenthood for health care for women?
Planned Parenthood is not in the business of healthcare. They're in the business of abortion, as they demonstrated by refusing Title X care. They could have financially and physically separated their abortion services from the rest of their healthcare services, but they refused to do that. They have decided that abortion is central to their mission, which is exactly why they fired CEO Leanna Wen, who, in her words, was ousted because she didn't prioritize abortion high enough.
And that's right. And if I might direct you to the chart behind me, in Texas, we have 301 rural health clinics in Texas, 434 federally qualified health centers, to total 735 federally funded community health clinics. There are 327 pregnancy centers, 130 of which are medical pregnancy centers. And according to the Planned Parenthood website, there are 40 Planned Parenthood centers in Texas. Does that number sound right to you?
Yes.
Does Texas, at least in the state in which I represent, provide health care solutions for women throughout the state of Texas?
Yes, they do. I'm from Texas as well.
Yes, ma'am. Texas program, Healthy Texas Women, was established in 2016 and has been helping women in Texas with services and with more providers than Planned Parenthood. Does that sound right to you?
Yes.
In FY 2018, Healthy Texas Women served 172,000 clients, according to the Planned Parenthood website of Greater Texas. In 2018, Planned Parenthood served only 83,000 patients compared to that larger number, and that's only been in existence in 2016. Does that sound right to you?
Yes.
My point is simply this. The state of Texas I can speak to. I can't speak to the other 49 states. We take women's health very seriously, and we should. We should create entities, and we should allow the market to thrive. And frankly, if we could get some of the regulations in the way of a healthy healthcare system, we could have more options. But could you please, my time is running out, please share your view of the ways in which we can provide healthcare in better ways than allowing an organization like Planned Parenthood, which takes unborn babies, puts them in plastic bags, and throws them in garbage bins, to be the center of healthcare provision for women? Thank you.
Abortion is not healthcare. I think that's all I have time for.
Chair now recognizes Congresswoman Norton.
I thank you very much, Madam Chair. Dr. McNichols, just to follow up here, what kind of health services do you provide?
I appreciate the question, Ms. Norton. So Planned Parenthood provides a broad spectrum of reproductive health care services, including well people care, cancer screenings, the full spectrum of birth control options, transgender care, primary care. Some Planned Parenthoods also provide prenatal care, and the list goes on.
So it looks like you provide the kind of across-the-board care that a young woman may need. You go and this one-stop fits all.
The goal is to meet our patients' needs, both in the clinical services that they need and require, and that the community needs, and also to make sure that it's accessible for
And
them.
abortion would be only one of those services.
That's correct.
I have a question. Perhaps I should start with Ms. Graves, or perhaps also Dr. McNichols. I represent 700,000 residents. They pay the highest federal taxes. This is a little-known fact. Highest federal taxes per capita in the United States. We're trying to make the District of Columbia the 51st state, but when you look at where there are intrusions into healthcare, you will find that there are federal bans that include federal employees, federal prisoners. Well, included in this list are low-income residents of the District of Columbia. Our jurisdiction wants to provide, on their own, pay for abortion services for low-income women, the way almost 20 states already do. We're not demanding that the federal government does this. My question is, why we are finding that restrictions on coverage are related to economic mobility for women, on coverage for abortion and other such services. And apparently there's a correlation here for not only for women generally, but especially for women of color. So why do restrictions on abortion relate to economic mobility? Why are they correlated in that way?
Well, I very much appreciate you raising that issue also as a resident of the district that lacks the range of voting rights that you described. And oftentimes, there's been a deep focus on the levels of restrictions that are in places like Missouri, but even in the district, because of restrictions on insurance, for low-income women in particular, what that means is that abortion is inaccessible and unavailable, and having to scrap together the money to be able to afford it is not possible. And what it also means is that for the most vulnerable of folks, the right to abortion does not feel very meaningful. And that connection between the ability to have economic security for yourself and for your family is deeply tied to your ability to access the health care you need. And so this is a travesty, and that is deeply felt by people who live in the district, in part because you not only have the restrictions on things like Medicaid, you also see them show up in federal health insurance, and so many people who live here are also working for the federal government.
So you can see that There are many reasons why the District of Columbia wants to become the 51st state. I just want to say to my Republican colleagues, you know, whose mantra is, we want government out of our business. My friends on the other side of the aisle vote against government doing things which the American people want government to do. All the District of Columbia is asking is that you get out of their business so that we can deal with our business alone. Thank you very much, and I yield back.
The chair recognizes
My
Representative
would my
Fox.
friend just yield her 20 seconds? Ms. Norton,
Yield to.
would you yield?
I'll be glad to yield.
I thank my friend. I just want to give Dr. Nichols an opportunity. We just heard a stunning statement that Planned Parenthood is not in the healthcare business, doesn't provide healthcare. I want to give you an opportunity to respond to that. Thank you.
I appreciate the question. Abortion is healthcare, and I think the best way to demonstrate that is to share a story about a patient who, when unable to access her abortion, died because her comorbidities and the complications she had prior to pregnancy worsened during that. A patient from out of state visited my clinic for a consultation after understanding that her current medical condition would worsen with pregnancy. She returned to her out-of-state home, having to wait a mandated amount of time between those visits before she can receive that care. When she didn't return and we called to follow up, we were later told that she passed away from complications of her pre-pregnancy medical condition. This is the very definition of why abortion is healthcare and is needed and is necessary when people need it where they live.
Thank you very much, Dr. Fox.
Thank you very much, Chairwoman. Dr. McNicholas, earlier this year, Governor Northam of Virginia said if a mother's in labor, I can tell you exactly what would happen. The infant would be delivered, the infant would be kept comfortable, the infant would be resuscitated if that's what the mother and the family desired, and then a discussion would ensue between the physicians and the mother. Do you support Governor Northam's comments?
So I can't speak for Governor Northam, but what I can say is that there is no way to oversimplify the sort of the medical conditions in which people present in the second trimester that I think that he was referring to.
So as a physician, then what would be the harm in legislation such as the Born Alive Abortion Survivors Act to make sure that a child born alive would not be put to death?
So there are several harms. The first is using that language and perpetuating the notion that that is actually a real thing is harmful in and of itself. And it only serves two purposes. The first is to shame people like Jenny who need life-saving care in the second and third trimesters of pregnancy. It also creates an environment in which abortion providers like myself and my colleagues are targeted and harassed. So first and foremost, it is dangerous for those reasons. The second reason is because medicine is complicated. There really is no way for me to boil down more than a decade of education and practice to give you a single reason why doing such things is harmful to patients.
The answer should have been either yes or no. Earlier this year, thousands of fetal remains were found in the home of deceased abortionist Ulrich Klopfer. Do you believe that all fetal remains should be disposed of in a manner that treats them with dignity and respect?
Just like I believe that patients are capable of making a decision to continue their pregnancy or not, to expand their family or not, I believe that patients are capable of deciding what should happen to the remains of their pregnancy.
So is it okay for those fetal remains to be sold for profit by Planned Parenthood?
Planned Parenthood has never sold fetal tissue and currently doesn't and never has.
Does Planned Parenthood v. Casey give states the authority to regulate abortion in accordance with the opinions of their respective constituencies?
I believe that the most recent decision, and we have some policy experts on the panel who can speak more to this, but the more recent decision in Whole Women's Health set a precedent that restrictions must be based and grounded in science, and that's all we're asking for, is that abortion is treated to the current standards of medical evidence and science.
Ms. Stuckey, thank you very much for being here. Are there more federally qualified health centers than abortion clinics in the United States?
Thank you for the question. Yes, the ratio is about 26-to-1 of healthcare centers that are federally funded to Planned Parenthoods.
And which offers more comprehensive health services to women?
Of course, the healthcare centers that are not Planned Parenthood.
So if we wanted to support access to comprehensive health care services for women, would we be better off supporting abortion clinics or federally qualified health care centers?
Federally qualified healthcare centers.
Thank you. In 2005, a Planned Parenthood-funded study found a majority of women seeking an abortion did so because having a baby would interfere with education and work, cost too much, or they did not want to be a single mother or having relationship problems. What are your thoughts on the findings of this study?
It shows that it belies this notion that abortion is only used in very extreme cases. The extreme rare cases are typically used to cast pro-lifers into a negative, extremist, radical, misogynist light, which is just not accurate. The majority of abortions, according to Planned Parenthood's own research, are done on the basis of convenience. And I just don't see a logical or a moral justification for killing an unborn child on the basis of them simply not being wanted.
Thank you. Madam Chair, earlier, Dr. McNicholas said that Dr. Williams was a physician and had taken an ethics oath and should know better than to do what he had done. I just want to quote from the classic Hippocratic Oath. I'll use those regimes which will benefit my patients according to my greatest ability and judgment, and I'll do no harm or injustice to them. I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan, and similarly, I will not give a woman a pessary to cause an abortion. Dr. McNicholas, did you swear a Hippocratic Oath when you were licensed?
I did, and I continue to live that every single day.
Amazing. Madam Chair, Mr. Roy asked me if I would enter into the record this article.
Without objection.
Thank you, Madam Chair. I yield back.
The chair now recognizes Representative Lynch.
Thank you, Madam Chair. I want to thank you for holding this hearing, and also to my friend and colleague, the gentleman from Missouri, Mr. Clay, thank you for your leadership as well. I want to thank all the witnesses here today, especially Mrs. Box, for your willingness and your courage to come before this committee to share your own experience, and all of you for sharing your perspectives. As I noted in my op-ed in the Boston Globe back in May, when this onslaught of state legislation arose, in Missouri, Alabama, Ohio, and Georgia, the legislatures have recently adopted draconian measures on abortion. Alabama has banned abortion at any stage of pregnancy, apparently even in the case of rape or incest, while several other states have banned abortions as early as 6 weeks, which, as some of our witnesses have noted, is often before many women would even know they are pregnant. In Georgia, a woman terminating a pregnancy after 6 weeks could be charged with homicide. These laws are far more punitive than those in place before the Roe v. Wade decision. They are so intrusive and so restrictive that the basic core constitutional right to privacy and protection from government intrusion into healthcare decisions would be effectively and totally eliminated. Meanwhile, other states are actively considering similar restrictive measures. This all occurs against a backdrop in which Republicans in Congress have repeatedly attempted to eliminate women's access to contraceptive services offered by groups such as Planned Parenthood. Ironically, even though those contraceptive services actually prevent unwanted pregnancies and thereby reduce the number of unwanted pregnancies and abortions. Ironically, in seeking to shutter many of these clinics, they would also be cutting off expectant mothers, especially in those low-income areas who rely on their services for the prenatal and postnatal care they need to ensure that they have safe and healthy pregnancies. It's to be noted that to be pro-life includes supporting the health of pregnant women. It includes feeding and educating and housing children. Simply opposing abortion does not make you pro-life. The Supreme Court's decision on reproductive rights, as controversial as they may be in our country, have sought to acknowledge and balance the constitutional interests that are at stake on this issue. And while critics abound, even without the onslaught of restrictive state legislation, the number of abortions that are performed in the United States each year has dropped dramatically, and that is largely due to the impact of effective and widely available contraception, family planning, and education. Women are and should be in charge of their reproductive health, and their efforts to reduce unwanted pregnancies are actually working, all of which leads many to believe that the timing and the similarities of this multi-state campaign reveal a purely political strategy to energize and motivate the religious right, and that is truly shameful. While I am personally informed by my faith, my actions as a legislator must be in support of, in defense of the Constitution. That is the oath that I took, and I stand by it. And as I said back in May, if these recent developments, closing all clinics, obstructing contraceptive services, denying women every option in their health care decisions, if this defines the new pro-life movement, then you can count me out. I have one question for either Councilor Graves or Ms. Howell, and thank you for your kind words regarding Mr. Cummings. So there are millions of women each year, and Ms. McNichols, you might have some, Dr. McNichols, you might have some input on this as well. If we have millions of women who come to Planned Parenthood and other contraceptive services providers, and yet the government steps in to deny funding, and this came to the floor. I spoke against this. This actually came to the floor when the Republicans were in control of the House, and they proposed to zero out any federal funding for Planned Parenthood to carry on its contraceptive services. What would the impact on the abortion rate be in the rate of unwanted pregnancies and the abortion rate if that measure had been implemented?
So I think you raise a very important point, which is one of the best strategies we have to reduce unintended pregnancy is, it's actually multi-layered. It's first improving the sexual education that we provide to our young children, helping them know how their body works and being very positive about understanding how sex works and how you get pregnant. Secondly, it's providing them access to the available contraceptive method of their choice when they need it, and without barrier, including going to a clinic in their neighborhood, making sure that it's affordable for them, and making sure that they can change that method as often as they need to when their history or their preference changes.
That's great. Councilor Graves or Ms. Howell, you want to add to that?
Many people actually go to Planned Parenthood for a number of different health care services. They go not only for birth control, but also to have tests for diabetes, for mammogram screenings. A lot of the people that we represent and that we work with go to Planned Parenthood clinics as their primary provider. And so to remove services that they think are vital to them because people are opposed to the fact that some Planned Parenthoods also do abortions, means that you are cutting off health care for people who most desperately need it.
Thank you.
The only thing I would add, it's a good opportunity for me to correct something Ms. Stuckey said about Planned Parenthood. We should be really clear about what happened with this gag rule that the administration put out. Planned Parenthood did not want it to do right by its patients. It was not going to lie to them, was not going to misinform them. And the idea that we are now in a situation where providers are being forced to make that sort of decision about whether or not they can continue to serve a largely the lowest income population in communities is really, really terrible, and patients are going to suffer for it.
Thank you very much. Madam Chair, I yield back.
Madam Chair, I have a unanimous consent request.
So you certainly.
I have a unanimous consent request. Okay. Thank you, Madam Chair. Being from Georgia, I just want to clarify that the law is not according to the what was just identified by my colleague, and I would like to ask unanimous consent to be added into the record, an article by David French that goes into the details of the law that the Georgia heartbeat bill would not imprison women who have an abortion.
Now
Thank you,
Representative
Madam Chair.
Massey.
Thank you, Madam Chairman. Dr. McNicholas, what's the medical consensus for age of viability of a fetus?
I appreciate the question. So viability is a complicated medical construct. There is no particular gestational age. There are some pregnancies in which a fetus will never be viable. There are a number of different factors that we think about when we're considering if a pregnancy is or isn't viable.
So is there a legal consensus on the age of viability?
Not to my understanding, but I'm a physician, not a lawyer.
What's, in your 10 years as a doctor, how many abortions have you performed?
So I provide a variety of different services, and as you...
I'm not asking about the other services. How many
Right.
abortions have you performed?
So I can't tell you how many hysterectomies I've done, and I can't tell you how many abortions I've done. I've had a long career of taking care of people for a variety of
So
things.
you manage a facility. Can you tell me, or you're the medical overseer of that, can you tell me how many abortions the facility in Missouri performs each week?
I can tell you, and I believe it's publicly available, so I can give you a rough estimate of how many abortions we perform per year, which
what's
is,
that?
I think, roughly around 3,000.
How do you dispose of 3,000 fetuses every year?
So Missouri has a state law that requires that we send all of the remains of pregnancy to pathology.
What's the latest term abortion that you've performed, like gestation period in weeks?
So my practice includes the provision of abortion up until the point of viability. And again, we already had a
Can you
discussion about
can you
viability
define
not
that?
being a...
So just give me the number in weeks then.
I don't know.
You don't remember the number of weeks?
That's
Or
correct. So
What about size of the unborn baby? Do you know the largest baby that you've aborted?
I'm not sure how I would even quantify that.
If I use the word fetus, do you know, you have no idea the age or gestation period of the fetuses that you're aborting?
So again, as I said, my practice includes abortion care through the point of viability, and as we previously discussed, that could be
Let me
at
put
any
it this way.
point. Yes.
Is there any point of gestation beyond which you personally would not abort a fetus?
You know, medicine is not black and white. I recognize, in my 10 years of practice, informs this opinion that pregnancy can be really complicated, and given that there are pregnancies for which a fetus may never be viable, I think it's really important that we allow physicians and patients to have every medical resource to make decisions that are appropriate for them and their health.
In the absence of a law preventing it, would you abort a viable fetus?
Again, every patient is different, and I can't make any...
I'm just asking about a viable fetus. If the law didn't prevent it, would you consider it a limitation morally for you to abort a viable fetus?
So I think you're forgetting that there are a number of reasons that go into patient's choice.
I thought you, at your clinic, does it matter what the reason is for the abortion?
At my clinic, I trust that women have a valid reason. Every reason that they have is valid.
Okay, so given that you think that every reason is valid, would you abort a viable fetus? if there was not a law preventing it?
Again, given that the reality for people choosing abortion is that there are many reasons, there isn't a single thing that defines somebody's choice. It is a reflection of their...
You seem to have a hard time saying this. This tells me you have a heart, or at least you know that people watching this have a heart, and they would be concerned if you would just admit, which you won't admit here, that you would abort a viable fetus for any reason if the law did not prevent it.
Mr. Massey, abortion is moral, it is important, it is health care, and I support people being the experts in their own lives and making decisions for themselves.
It gives me some hope that you here understand that people do not support you when you say, or if you would say that you would abort a viable fetus for any reason. But given what you told us in your opening statement and knowing what you've said, we know that you would, but it does give me hope that you still know in your heart that's wrong. Mrs. Stuckey.
I'm not sure. Can I respond to that really quickly?
If you would answer my question, you could, but you won't. So I'm going to use my remaining time asking Mrs. Stuckey, should any reason be a good reason for having an abortion?
Absolutely not. It's a child. It's a life inside the womb from the moment of conception onward. And I'm very troubled by how flippantly she said that there are 3,000 abortions performed every year of defenseless human beings, and the remark that abortion is moral.
Time has expired.
I reckon that kind of logic driving my lifestyle.
No, the time has expired. I recognize.
Gave the others over 2 minutes over, Mr. Chairman. Mr. Chairman, we need to be fair on both sides of the aisle, please, sir.
You want to finish your...
Please, I'd like for...
No, finish your answer. Go ahead.
I don't quite understand the logic of saying that killing a child inside the womb for any reason whatsoever is moral, is healthcare. In what other situation, besides when a child is defenseless in the womb, do we call killing someone healthcare? Do we call killing someone moral? Can anyone on the pro-abortion side tell me a situation outside of a defenseless child inside the womb in which it is morally justifiable to kill someone simply because they're not wanted? That's the answer, or that's the answer that I would like. That's the question that I have. I unfortunately don't think anyone's able to answer it for me.
I recognize the gentlewoman from Illinois, Ms. Kelly, for 5 minutes.
Thank you, Mr. Chair, and thank you for this hearing. My Republican colleagues have suggested that earlier restrictions on abortion have become necessary because advances in medicine are moving the point of viability earlier and earlier. Dr. McNichols, I am interested in hearing your thoughts on this point.
Thank you for the question. So I think, as I previously alluded to, viability isn't an easy thing to assess. It requires...
It's different with every pregnancy.
That's exactly right. It requires knowledge of multiple things about any individual's pregnancy.
Thank you for clarifying. First of all, I want to thank the witnesses for being here. Thank you for sharing your story with us. And then I want to let you know that I was a proud board member of Planned Parenthood in Peoria, and I'm very proud that my state of Illinois is an oasis in the sand. Very proud that we're a shining light in the dark. And Mrs. Stuckey, you said you want to see the same basic compassion. You made that comment. Well, I wanted to see the same basic compassion for maternal mortality. I had to water down the bill I had because the compassionate Republicans, not one, would sign on to the bill to extend Medicaid. We have not been able to get a gun violence prevention bill passed because we don't have the same basic compassion once the unborn fetus becomes a baby and they grow up. We don't seem to have compassion in that area. We don't have the same compassion when it comes to feeding our young people. We don't seem to care about that. We're looking at cutting back so 500,000 people don't have the food they had. So where is the compassion once you're born? That's the question I have.
Well, Ms. Kelly, thank you so much for bringing up these points, because I agree that we should have compassion from the womb to the tomb. That's what I believe. I don't necessarily agree with all of your legislative solutions to that. I do believe the private sector does a much better job, but your premise is that these things are mutually exclusive, that we either have to be on your side of the debate and we're violently murdering children inside the
never heard
womb,
me.
or we're not.
No, I'm
really
just
pro-life.
saying,
They're
like
not
you're
mutually
saying we're
exclusive.
violently murdering, but there's a lot of kids being murdered every day.
And why can't
we
we
don't
care
do
about
anything
both?
about that.
Why can't
I'm
we care
reclaiming
about
my
both?
time. Reclaiming my time. In the wake of many draconian measures, my own state of Illinois recently signed into law a bill to protect abortion access for our residents. The Illinois Reproductive Health Act ensures coverage for abortion care and updates clinic regulations to lift that burden from abortion providers. Ms. Goss-Graves, how does eliminating coverage bans improve access to abortion care for women who are working to make ends meet?
It'll mean that the right to abortion, which has been legal for almost 50 years, will actually be a right that's accessible for women. For women, no matter their income. Whether or not that right is accessible to you should not be depending on your financial means. That's not what the court said.
Because the other thing we never talk about is, wealthier women who tend not to be women of color, they've been having abortions for a long time, whether they're in red states or blue states or however they vote or whatever their political interests are. And how will rolling back targeted regulations of abortion providers improve access?
Here's what we know. These targeted regulations of abortion providers are designed really to shut down clinics. They're designed to shame patients. They're designed to confuse people and disrupt the doctor-patient relationship. All of that makes abortion less accessible. And all of that, I have to say, the rhetoric that is surrounding it, on top of the sorts of regulations and restrictions, have made all of this so difficult for people who are just trying to live their lives and get the health care that they need.
And I know from a lot of college students that they're not going to Planned Parenthood to get an abortion, they're going for health. That is their place of choice, to get health care, not for abortions.
Yeah, Planned Parenthood is very proud to be able to provide services to people who are financially insecure, and to do that in a way that serves their needs and respects their dignity.
Thank you, and I yield back my time.
The gentleman from Georgia, Mr. Heiss, is recognized for 5 minutes.
Thank you, Mr. Chairman. Seems to me that a lot of this debate and argument centers around whether or not the baby is a person or a fetus, and I recognize that many on the other side of the aisle refuse to recognize the baby as a baby, refuse to recognize it's a person, it's humanity. Ms. Stuckey, there have been a lot of medical advances, certainly over the last several decades. Can you tell us about some specific scientific evidence supporting the personhood, the humanity of the baby, and the viability?
Well, embryology tells us, thank you for your question. First of all, embryology tells us that the child from the moment of conception has a separate DNA. And so when we hear these euphemisms thrown around, like my body, my choice, immediately obscuring the life of the child, it shows me that the pro-abortion argument doesn't deal with fact, it deals with feeling, which is exactly why we've had such a hard time getting any kind of clear answer from any of the panelists of what abortion actually is. What does it do? Because talking about tearing a child apart limb by limb with forceps just isn't a very good PR strategy for Planned Parenthood or the abortion industry. All I'm trying to do is to remind us when we're having this conversation that there are two people. There are two people. And I don't believe that we have to pit a mother against her child in order for a woman to be successful. We talked about, legislative solutions and showing compassion for children after they're born. I absolutely believe in that. Every pro pro-life pregnancy center that I've ever been a part of, that I've ever donated to, they don't just counsel women. They also offering parenting classes. They are also offering help from abusive situations. They are offering programs for these young women to be able to get affordable baby clothes and baby products and things like that. And so every pro-life organization I know cares about children in the womb after they're born and the mother who is pregnant with these children. That is what I am trying to argue, that let's not ignore the scientific reality that a baby is a baby and therefore, in my opinion, is deserving of the right to life.
And the way this is even going beyond abortion in the womb, as we all were horrified, many of us, Virginia Governor Ralph Northam, in his description of however it could possibly be described as a post-birth abortion, one of the most horrifying things I've ever heard in my life, where the baby would just sit there on the table and we would decide what to do with it. How do you respond to this?
Yes, that's a great point that you bring up. Unfortunately, this has been a reality in other places across the country. We like to act like this is not a thing. The CDC itself says that over a span of 11 years, at least 143 of babies were born alive and then not resuscitated, or born alive and not attended to and cared for. Only 6 states actually require this kind of reporting, so the number of 143 is probably a lot higher than that. So what we see that this is not just a degradation of children inside the womb, it's a degradation of babies in general. It's a degradation of life based on whether or not this child is wanted by the mother. And again, I ask, in what other context, in what other stage of life do we decide that someone gets to die simply because they're not wanted? And not to provoke a slippery slope fallacy, but truly what we've seen from Governor Northam's statements and from other statements that we have heard is that it truly is a slope. There is a logical and a moral slope to this, and it seems like the pro-abortion side is sliding down very quickly.
Well, and to that point, and I think it is likewise an excellent point, you brought forth a while ago Planned Parenthood's own study that the majority of women have abortions not because of their own personal health, but because of convenience sake, whether it be a job or whatever it may be. How does those findings from Planned Parenthood itself undermine the narrative, particularly about late-term abortions, that it has something to do with the health of the mother?
Yes, and we can have conversations about the health of the mother in those very rare circumstances, but as you mentioned, and as Planned Parenthood has noted, the vast majority of cases are for any reason whatsoever, including just not wanting a child, it not being convenient, wanting to finish school. And if the pro-abortion side were honest, they are completely fine with that. They are completely open to the normalization. There are organizations now that exist to normalize abortion, to destigmatize abortion. That means that they believe abortion to be not only normal, but good. Actually, we heard the doctor say that she believes that abortion is good. And so if you believe that abortion is morally good, of course you don't think it should be limited to the life of the mother or any of those very rare circumstances. It is all 9 months, on demand, without apology. That is the new motto of the pro-abortion side.
And the fact is the baby is a person. And for that reason, how could it be moral to kill it?
I don't know what else it is if it's not a person.
Thank you. I yield back.
The gentleman yields back. I recognize the gentlewoman from Michigan, Ms. Lawrence, for 5 minutes.
Thank you, Mr. Chairman, and I'm glad to be here for this hearing. This hearing should be a substantive discussion on how to expand access to care for women. I'm disappointed that my Republican colleagues are using this hearing to make such blatantly false claims. The young lady who speaks in generalization, and for the record, while one side calls themselves pro-life, there's not a person I know that say they're pro-abortion, they're pro-choice. So abortions are not infanticide. That is not how abortion works. And this type of deceptive rhetoric is yet another attempt to distract from efforts to make abortion out of the reach for women to shut down clinics. And I just constantly, I've had this debate a number of times on this panel, the mistruths that are spoken about ripping full-size babies out of wombs and killing them. That is not true. Selling of parts is not true. And it just seems like it's enjoyed to say because it paints this horrific picture. And we should say the truth. Statistics. Mrs. Box, I'm so sorry to hear about the pain you and your family had to suffer. And thank you for bringing the beautiful baby in the room. Have you considered whether this law that is being proposed or passed in Missouri would have prevented you from having an abortion if it had existed 2 years ago?
Thank you. It absolutely would have prevented me from having an abortion. At 8 weeks, which is when the ban that my state legislature passed, it's impossible to know of the chromosomal abnormalities. As far as my understanding, I'm not the doctor here today, but we did the early genetic testing because I am of advanced maternal age, and so not another one of my not favorite terms.
Yes.
But, and so I believe that we found out before most women and families would find out, because we found out earlier because of that. Most people would not find out until the 20-week anatomy scan. And I can say that after Libby, I was obviously able to successfully get pregnant again, as evidenced by my beautiful daughter, who's now being quiet, thankfully. And so I was pregnant during the time that the state legislature was enacting this ban and that Governor Parsons signed this into law. And at our 20-week ultrasound for Astrid, they couldn't get a couple of views of the heart. Everything looked good, physicians weren't concerned, but what should have been a happy day to know that we were having a successful pregnancy, because a pregnancy after a fetal diagnosis is a very stressful pregnancy, ended with me being in the car, my husband and I walking out of the appointment, and me being in the car sobbing hysterically because they wouldn't see me again until I was 24 weeks along. And in Missouri, because they weren't worried, right? That was my next regularly scheduled appointment. And in Missouri, that would have been too late. And what I kept saying to Jake, to my husband, is, what if they find something devastating now? I can't protect my daughter. And I understand that Mrs. Stuckey and I don't agree on things, but I would like to ask you to remember that you're calling me and my husband murderers, and you believe in compassion and love, and I would ask for compassion and respect, ma'am, when you speak about these decisions, because Americans make these decisions that are difficult and personal, and we deserve to be treated with respect whether or not you condone our choice. I don't need your approval, Mrs. Stuckey, but I would ask for your respect.
I appreciate what you're saying. In the few minutes I have left, I just want to bring another issue to the table. We in this country have the highest maternal mortality rate of any civilized country in the world. And for women to be dying to give birth in America is unacceptable. And with the same energy that we're making health decisions and decisions about our bodies, and we should, as women in America, have the same choices that men have without the government telling them what to do. I often use the comparison because now there's discussion about birth control. I would love to have a debate about Viagra and whether the government should regulate or restrict Viagra for men. That's never been on the table. And so women, we are targeted. And for us to have the same passion of a discussion about saving women who want to have their babies, and this medical industry is failing us, we need to have the same passion. I yield back my time.
Gentlewoman's time has expired. I want to say to Ms. Box, we are sorry that you and your family had to experience what you did. And now I recognize the gentleman, Mr. Grothman, for
Correct.
5 minutes.
Correct. A couple of quick questions for Dr. McNicholas. If someone came to you who was 8 months pregnant with a healthy baby girl and said they wanted to have an abortion because they didn't want another girl, would you perform that abortion?
So that sensationalized hypothetical isn't real, and I've never had that happen before.
Well, you said you'd perform an abortion, it's up to, I'm just giving you an example. Or let's say, okay, someone came in with an 8-month pregnancy and just wanted to have an abortion because they didn't feel they had time to care for a baby. Would you do the abortion then?
So I first want to reject the notion that people make decisions about continuing a pregnancy out of convenience. I have never, in 10 years of taking care of pregnant people, had somebody request an abortion because it just wasn't convenient.
Okay. Do you report, people presumably come to Planned Parenthood for contraceptive care as well. If a 14-year-old or 13-year-old came to you, would you give them the contraceptives?
So we talk to all of our patients about the availability of all of their contraceptive methods, and particularly for young people, we would have an in-depth discussion about healthy behaviors, prevention of sexually transmitted infection, the importance of making informed decisions.
What I'll say is if a 13-year-old is sexually active, by definition, that's a serious sexual assault. Do you make any efforts to report the person who is engaging in illegal activity with the young lady?
So we at Planned Parenthood follow all the rules and laws, and so we would, if by law we're required to do it, we would do it.
Would you make any efforts? Would you make
If
any
we're
efforts
required to do it, we would do it.
If you weren't required to do it, you wouldn't do it.
You know, talking to young people about their sexual health can be a really...
I'll ask you another question. If someone comes in as a 13-year-old girl and wants to have an abortion, would you, which means inevitably or almost certainly something illegal was done, a serious sexual assault, would you probe into that anymore? Would you just do the abortion and not worry?
So one of the most impactful times I have with patients is discussing particularly around issues of sexual assault. We provide our patients with the space to discuss what happened if they want to discuss that, recognizing that it can be incredibly traumatic to discuss that experience in any single health situation. And so I would respect whatever is comfortable for her.
I'll give you another question. If someone comes in and doesn't have the money for an abortion, says they're broke, but I want an abortion, maybe 7 or 8 weeks pregnant, do you perform the abortion? Do you say then we don't do the abortion?
We make every effort to take care of patients' every needs, regardless of their financial insecurities.
So as I understand it, talking to people in your industry, you will find a way to do an abortion, whether the government's paying for it or nobody's paying for it. Somehow you'll find the money or to do that abortion, correct?
So to set the record straight, the government does not pay for abortions. People are navigating the complexity of paying for basic health care because the government has abdicated its responsibility to pay for that care.
You don't turn people down. That's what I
We do not turn people away.
Correct. I have toured some abortion clinics, and one thing that struck me about the abortion clinics, at least, and it was like 20 years now since I toured them, is they never use the word abortion and they never use the word fetus. They always use the words procedure and tissue. Do you still follow that policy in which we try to avoid using the word fetus and abortion and use the words procedure and tissue?
20 years is a long time. I invite you back to our clinic to see what happens there. And I absolutely use the words fetus and abortion. And actually, I take the direction of from my patients who absolutely understand the potential life that is in their uterus. Most patients who have abortions are parents. They are well aware of the fact that what would happen if they didn't have an abortion is that they would have a baby.
We, running out of time here. We did pass a 24-hour waiting period bill in Wisconsin. Do you have a similar bill in Missouri?
We have one of the most restrictive waiting period bans in Missouri. It is 72 hours and requires the same physician.
Okay. The question I have for you, it came out as part of a lawsuit in Madison, Wisconsin, that because of the waiting period bill, about 10% of the women who came in the first time around, I believe even gave a given amount of money, didn't come back the second time, which would indicate they were very much on the fence, and given some more time to think about it, they decided not to have the abortion. Percentage-wise, of all the women who come in to see you the first time, what percent don't come back the second time in Missouri?
I think you made an assumption about what that 10% means. My informed assessment of that would be that those 10% of women really struggled to figure out a way to get back because they didn't have the financial means, the secure transportation needs, the ability to navigate additional time off of work or find somebody to watch their children while they were trying to access that care.
So, but you're not going to answer my
The
question? Please.
gentleman's term has expired.
Well, thank you for being so.
I recognize the gentleman from California, Mr. Connor, for 5 minutes.
Thank you, Representative Clay. Thank you for your leadership in convening this hearing. I would like to discuss state and federal restrictions to abortion access and the disproportionate impact that they have on LGBTQ+ patients. Dr. McNicholas, a few questions for you. First, could you briefly describe the need for abortion care among the LGBTQ+ community?
Absolutely. Thank you for your question. I think the first most basic thing that most people forget is that your sexual orientation does not define who you are having sex with. And so people in all of those communities may experience pregnancy. Similarly, and I've had the honor of taking care of many trans and non-binary folks in my career, so long as you have a uterus, you have the capability of getting pregnant. And if you think that accessing abortion care is stigmatizing when you present as a woman, imagine what it is when you're presenting as your authentic male self.
I appreciate your mentioning that there are transgender men and non-binary individuals who rely on reproductive health services and abortion services. In 2015, when the National Center for Trans Equality surveyed transgender Americans, 23% of respondents didn't see a doctor when they needed to because of, quote, fear of being mistreated as a transgender person. As a doctor, can you describe some of the challenges gender-diverse patients face in accessing health care and abortion care specifically?
So in my practice, I have, again, had the great honor of taking care of many, specifically trans men seeking hysterectomies in their transformation process. And one of the things I hear from them unequivocally, each one of them, is that there have been tremendous delays in accessing very basic care. One, because they're afraid that they won't be treated with dignity and respect. And the second is because that is their lived experience. They have been turned down by many patients, physicians, and have been intentionally degraded with, for example, use of intentional misgendering of the patient in front of them.
And can you also describe some of the specific challenges that gay, lesbian, and bisexual patients may face in abortion care specifically?
Sure. So I think it's important to remember that gay and lesbian folks also want to build families. They are parents. I myself have a wife and a child, so I fit into that group as well. It is important that they're able to access that care in a place where they feel respected and dignified, and Planned Parenthood is happy to be one of those places.
Thank you so much for speaking to those issues. Turning to you, Ms. Howell, transgender people are 4 times more likely than the general population to live below the poverty line, and close to 1 in 4 lesbian and bisexual women in the United States live in poverty. Yet current laws prevent federal Medicaid dollars from being used to cover abortion services. How do these funding restrictions overlap with identity to make abortion even less accessible for the LGBTQ+ communities?
The discrimination that people go toward, and because they are either trans or gender non-binary or LGBTQ, it really does hit them harder because, as was already mentioned, they're afraid to go and get services. And when they go to get services, they find that some of the current regulations allow people to discriminate against them. And that they then find that they don't have any access to getting good reproductive health services, much less regular health care services. Our organization does believe that all people have the right to get reproductive health services, regardless of whether they identify as LGBTQ, whether they are trans, whether they are low income. All of these factors should be taken into account to allow them to get the kind of services that they deserve. And so laws or regulations that have been done by this government that allows other people to discriminate against them puts them at higher risk. And those are the kind of laws and regulations that we fight against.
Well, thank you, Ms. Howell. Thank you, Dr. McNicholas, for your advocacy for some of the most vulnerable populations, and I believe we need to really consider their access to health care as we craft these laws. I yield back my time.
Thank you. Representative Cloud.
Thank you all for being here. I appreciate you all coming to take part in a discussion that is no doubt very emotionally charged with very deeply held beliefs of conscience on both sides of the issue. For me, the most difficult decisions we have to make as lawmakers are those in which individual rights are in conflict with each other. And so for me on this issue, where I come down is to the whole life, liberty, and pursuit of happiness, which rights supersede. And I do believe that while having compassion for anyone who has to go through a difficult situation, that the right to life supersedes the right to liberty and the pursuit of happiness. And so in that context, I approach this conversation. Dr. McNichols, could you describe what happens in the process of an abortion to the baby?
So I appreciate your question, and I want to first note that abortion was around before there was any concept of life, liberty,
Could you answer the question? I only have 5 minutes,
the pursuit
please.
of happiness. The abortion procedure really depends on the clinical situation. When I speak to patients about their options for terminating a pregnancy, I start with where are we in pregnancy?
I only have 5 minutes. Could you speak to the process, please?
So I realize it's difficult, but in medicine, things aren't short. There's 100 shades of gray, and so it's impossible for me to take what is often a 50-minute conversation with a patient and answer it in 30 seconds for you. As I approach patients, I talk to them about what their options are for pregnancy termination, and that really depends on a variety of things, including what stage of pregnancy they're in, what are their other medical comorbidities or health problems that they have, were there any particular instances in previous pregnancies,
Okay,
for
I'm going to have to
example?
move on. Ms. Stuckey, could you describe what happens in the process of an abortion?
Well, apparently I'm the only one willing to talk about specifics. And it's just free online. Anyone can go look. Even Planned Parenthood's website describes pretty clearly what, for example, a D&C abortion is, which is the taking out of the amniotic fluid, drying that up from the uterus, which is what, of course, the fetus, the baby, needs to survive, and then dismembering the baby limb by limb with forceps. And Ms. Lawrence spoke to that being deceitful or hyperbolic. It's not at all. Please go look online and you can see what an abortion actually is. But again, we see that it's not me that's speaking in generalities. It is the pro-abortion side that's speaking in generalities because they know the grotesque nature of what an abortion procedure is. You don't have to be an abortion provider to know what an abortion is. That's exactly why I'm here, to talk about the absolute brutality of the killing of life inside the womb. And I also want to address Ms. Box, who I have the utmost compassion for. One, I actually did not say the term murderers to my recollection, and I don't think that me being passionate about this subject, which we do disagree on, means that I disrespect you. I think that we can agree or disagree even passionately without taking that as a personal slight, and I certainly didn't mean it that way. I just care about life inside the womb and protecting babies unborn.
Okay, I have very little time left now. But Ms. Graves, you mentioned that nothing's changed since Roe v. Wade except for the makeup of the Supreme Court. The reality
I
would be...
actually said since that, I just want to correct you because
Yeah.
I was talking about the whole women's health decision, which was 3 years ago, and
Okay.
the case that's going to be before the court this term, the June Medical Services.
But a lot has changed. Science has developed a whole lot. Back in the 70s, it was rare for a woman to have an ultrasound, isn't that correct? Now we know a whole lot. We know that a baby can be viable at 20 weeks. We know that a baby feels pain. I ask unanimous consent to submit this peer review scientific article on fetal pain that a baby feels during abortion. There's a lot that's happened since this is, and certainly I think the scientific advances merits us relooking at this.
And the Supreme Court did 3 years ago in the whole women's health decision. It considered and
Dr.
reaffirmed
Nichols,
what
you
Roe-
mentioned a number of health inspections at your abortion clinic when you just took over. Were you aware of the history of health violations at your clinic before you took over?
So our clinic has been subject to repeated inspections every year, which we have passed with a single inspection every single year up until this year, when clearly it was no longer about ensuring the safety of patients, and it became about a quest to end abortion access.
Okay, well, I'd ask unanimous consent to submit to the record, this is only 7 states of health code violations at abortion clinics from a...
No objection. We accept this entry. Thank you. And your time has
Unfortunately, my
expired.
time's up.
Okay. I now recognize Congresswoman Presley for her questioning. She has been a tireless advocate for these issues on this committee. So thank you for your leadership.
Thank you, Acting Chair Maloney, for holding the line on this first full committee hearing since the transition of Chairman Cummings. Thank you, Ms. Box, for modeling that which she spoke of often, which is turning your pain into purpose. We thank all of you for being here. Elijah Cummings often reminded us that we are to be in efficient and effective pursuit of the truth. And so we are still trying to arrive at that, it seems, today. This conversation could not be more timely as we bear witness to and experience this administration's calculated and systemic attacks on our constitutional rights and freedoms, the right to determine our own economic future, and the audacity to determine our own fate, and the freedom to determine when, if at all, to have a child. Even in states like the Commonwealth of Massachusetts, which I represent, individuals, particularly low income and young people, LGBTQ and Black and brown folks, continue to face barriers in accessing comprehensive reproductive health care. And let me be clear, health care is abortion care. But in these times, we've seen many states, emboldened by this administration, pass additional restrictions that further hinder individuals' access to abortion, endangering lives and criminalizing individuals for decisions that should be kept between themselves and their doctor. It's important to discuss these draconian state restrictions, but as chair of the Abortion Rights and Access Task Force of this first ever pro-choice majority in the history of Congress, I would be remiss if I didn't also shed light on the impact that federal coverage bans are posing on our most vulnerable communities. Current law restricts Medicaid funds from covering abortion care for women in communities across the United States. To be clear, the Hyde Amendment functioned as the original abortion ban for low-income individuals. According to the Guttmacher Institute, restrictions on Medicaid coverage for abortion services force 1 in 4 low-income women to carry unwanted pregnancies to term. Ms. Goss-Graves, how do coverage bans like the Hyde Amendment force low-income individuals further into poverty?
So just at what for some women is the hardest time in their life, around being pregnant, they are now in a situation where because they're on Medicaid or because they are on a federal health plan or other federal restrictions, they no longer are in a situation where their health care can be covered by insurance like the rest of their health care. So all of a sudden, you're having to scrap together money on top of a range of other barriers. Those barriers may look like having to travel long distances. Those barriers may look like having to pay for childcare because of multi-day waiting periods. So it is not only the restrictions on coverage, you also have these other costs. And for the right to abortion, which has been legal for 50 years almost, and reaffirmed again and again and again by the Supreme Court, most recently just 3 years ago. That right is not just for those who are affluent. That right is not just for those who happen to live in a state and where the state is trying to make up for the very serious gaps in federal coverage. That right is a fundamental right. It is a right that is tied to your ability to have dignity in this country. It is right that is tied to your ability to have freedom in this country, and it is fundamental to your economic security.
Thank you. I'd be remiss if I did not acknowledge sitting next to me a champion in the efforts for decades now to repeal Hyde. I want to acknowledge my other sisters in service from our pro-choice caucus who were waved on today, Representatives Chu and Schakowsky, respectfully. Thank you for being here. Each year, 700 women in the U.S. are likely to die during childbirth. These numbers are even worse for Black and Native American women. Ms. Howell, could you speak to your report recently issued connecting the impacts of abortion bans on our maternal health crisis? And I would be remiss, I just wanted to acknowledge, since there was this conversation about compassion for the innocents. Earlier today, I rolled out the People's Justice Guarantee, which calls for the abolishing of the death penalty. And in fact, 1 in 25 are wrongfully convicted and innocent. So I look forward to my colleagues on the other side of the aisle signing on to my legislation. Ms. Howell?
The report that you referred to looks at the correlation between maternal mortality and states that have placed these bans on against abortion. And what we know is that if you decide that you need to terminate a pregnancy and you're denied that care, it puts additional stress on you. We also know that women who are denied abortion care tend to delay prenatal care. So again, there's an additional stress as well. And I might add, I want to give you some of the states that have some of the worst abortion bans and also some of the worst maternal mortality outcomes. Alabama, Georgia, Ohio, Missouri, unfortunately, and a lot of the southern states, South Carolina, Texas. Those are the states that primarily have these outrageous abortion bans that prevent people from actually accessing abortion care, but they also have
The
the
gentlelady's
highest
time has expired.
mortality.
Could you please wind down? Your
They
time
also
has
have
expired.
some of the highest mortality rates for maternal mortality. And so we have to look at both of those things together in terms of what it means to access good reproductive health care for people.
Thank you, Ms.
Thank
Howell.
you.
Thank you, Madam Chair.
Thank you. The chair recognizes Representative Miller.
Thank you, Madam Chairman and Ranking Member Green, and thank you all for being here today. As a mother, I have had the privilege to feel life quicken in my womb. As a grandmother, I know the joy of grandchildren. I've gotten to experience endless joy having grandchildren because it's just unconditional love. I've had family members and friends who have yearned to be parents, but were unable to have children of their own. I have had friends and family who have been adopted, and they are very grateful. I have friends and family who have adopted children, and they are very grateful. They have brought such blessings to their family. However, I've become increasingly concerned as of late about the actions taken by my colleagues across the aisle. Washington Democrats refuse to protect babies even after they're born alive after an abortion attempt, and it's so heartbreaking. Our most vulnerable and youngest citizens deserve our utmost protection. Ms. Stuckey, speaking of medical innovation, I think we can all agree that women having access to all health care is important. That being said, not every Planned Parenthood provides comprehensive women's health care. Can you elaborate on the positive steps that the Trump administration has done to not only protect life, but to ensure that women have better access to health care through federally qualified health centers?
Yes, thank you for that question. First, I do want to address an issue that I think that we can all agree on, that the maternal mortality rate in this country, in a developed country, is way too high, and it is. I think the number is 3.3 times higher for African American women than it is for white women, and I fully believe that we need to address that, and I would encourage the Trump administration to address that. I don't understand why the exclusive solution that we discuss when we talk about the maternal mortality rate is abortion. Why is that the only solution that we discuss? Can we not come together and talk about how can we best care for a woman and her child? Why do we have to sacrifice the child for the health of the mother when that is not medically necessary? And so President Trump has been the most pro-life, if you want to call it anti-abortion, I'm fine with that too, anti-abortion administration since Ronald Reagan, maybe even more so than Ronald Reagan. with the Mexico City policy, and of course, we know enacting the final rule for Title X that says you have to physically and financially separate your abortion services from the rest of your contraceptive care in order to receive Title X funding. And I heard earlier a comment about this gag rule. Well, it's actually not a gag rule that the Trump administration enacted. It is you cannot encourage someone to get an abortion, but you can counsel them neutrally. So that's not actually a gag rule. It's not a limit on free speech. President Trump has ensured that these policies can go forth and, of course, given states the freedom to protect life inside the womb, and for that I'm very thankful.
You might be familiar with efforts by House Republicans to protect babies who are born alive after an abortion attempt. Many argue that the Born Alive Act is unnecessary because doing so violates existing criminal law. Do you believe federal law should be clarified to ensure babies born alive after a failed abortion should receive critical medical care?
Yes, it needs to be clarified. So this new law the Democrats have tried so hard to blockade simply criminalizes the neglect of an abortion provider to attend to the medical needs of a child who survives an abortion, further recognizes this child's personhood, and says this is the medical treatment that is required for a child outside the womb. We're not even talking inside the womb anymore. And unfortunately, Democrats cannot even get on board with that. There are not any undue burdens, undue regulations. This is not preventing abortion providers from even giving abortions. It's simply saying if a child survives an abortion, attend to that child. It should be really simple. If you really are pro-choice and you're really not pro-abortion, as I've heard many times during this hearing, that should be a no-brainer.
I understand a baby can survive as early as 23 weeks old. Can you elaborate on how age of viability has changed in the recent years and what's made that possible?
Well, as technology and medicine advances, thankfully, hospitals are able to give incredible perinatal care so that a child as young as 21 weeks actually has been known to survive outside of the womb. I mean, that's pretty early in the second trimester. That's only halfway through the pregnancy. At 24 weeks, that is generally accepted as the age of viability. What that means is that that child has a really good chance, if she were to be born prematurely, to live outside the womb, to grow. She would spend some time in NICU, but she would grow up, if everything went well and she was healthy, into a normal functioning child. You wouldn't even be able to look back and tell that the child was premature. So when we're talking about these children as if they're not children, as if they're not babies, we're talking about mere location. I mean, on the one hand, we talk about them as if they are just these parasites to be discarded as these remains of pregnancy, I think is what I heard the doctor say earlier. And then a second later, when they're outside of the womb, they're all of a sudden babies. Although, unfortunately, as you pointed out and other congresspeople have pointed out, even then, they don't seem to be respected by the pro-abortion side.
Thank you. I yield back.
Thank you. I understand that the witness, Mrs. Stuckey, has a flight she has to catch, so I will dismiss her, noting that there may be other additional questions that I request that she answer them in writing. And thank you for your testimony, and I hope you don't miss your flight.
Me too.
So the next speaker will be Debbie Wasserman Schultz from Florida. Congresswoman Schultz.
Thank you, Madam Chair. Madam Chair, I have a question of you, and in fairness, I'd like Ms. Stuckey to hear my question, because I wouldn't want there to be any assumption that I was saying it as she was no longer in the room. I just want to clarify that Ms. Stuckey is here expressing her own opinion exclusively and has no scientific or particular expertise in this subject matter whatsoever. Is that accurate? No, I wanted to ask you, from what your knowledge of her experience is in the description of the witness's experience.
That's my understanding.
Thank you. I just wanted to clarify that particular fact.
But I think the witness should answer in all fairness, as she's here.
I think it says something when I, the one without the scientific or medical background, am the only one to give you specifics on what an abortion procedure actually is.
Reclaiming my time, Ms. Stuckey, my question was not of you, and you have essentially acknowledged that you're here expressing your own opinion, which we appreciate. So The other thing I wanted to point out was that no one here today has said that abortion is the only solution to address the maternal mortality rate. How about better access to prenatal care? How about the passage of the Affordable Care Act and making sure that it remains the law of the land so that women are no longer considered pre-existing conditions just because of our existence as women, and the potential for us to be dropped or denied coverage because of our propensity to get pregnant and have babies, which happened all the time before the Affordable Care Act was the law of the land. I could go on with many other provisions that we advocate to make sure that we can reduce the maternal mortality rate. Certainly, abortion is not the only thing we suggest, and in fact, is not a solution that we ever suggest to reduce the maternal mortality rate. It's a ridiculous suggestion. What isn't a ridiculous suggestion is that the decision to become a parent is one of the most important and most personal life decisions that we make. Watching the rapid expansion of state laws that limit a woman's autonomy to make this personal choice for herself is deeply troubling. This fight for reproductive freedom is one that we are all too familiar with in Florida. I've seen Republicans in my home state in the legislature introduce bills that ban abortion after 6 weeks, ban abortions that are based on certain medical diagnoses, and right now are fast-tracking a proposed draconian parental consent law. We need to be unequivocal about calling these laws out for what they are: sinister attempts to interfere with a woman's right to make her own personal health choices and decisions, and obvious steps in a larger political plan to ban all abortions. As we've heard, Missouri has enacted so many restrictions on providing abortion care that only one clinic is left standing. Because my time is limited, I want to ask Dr. McNicholas, the excuse that a patient can just drive to another state to receive medical care, is that an acceptable rationale for any other type of medical service? And is it accurate to say that requiring medically unnecessary patient delays, whether that's to gather travel funds or make lodging and caregiving arrangements, would lead to women having later abortions, which are more expensive and can pose a higher health risk?
Thank you for the question and acknowledging the sort of many intersecting realities that people are navigating when they're trying to access basic care. And in Missouri, for many of them, that means driving hundreds of miles multiple times. I'm reminded actually of a patient I took care of recently in the second trimester who actually was able to get to the clinic the first time very early at 6 weeks of pregnancy. She went home and scheduled her clinic procedural date for about a week and a half later, but unfortunately was in a car accident on the way to that appointment. Because Missouri's law not only requires a waiting period, but requires it to be with the same physician who will ultimately perform your procedure, her 2-visit abortion became a 4-visit appointment visit, and she was pushed from 7 weeks to 15 weeks. This is exactly what happens when there is no context and no medical or scientific grounding in abortion restrictions. Patients are pushed to later and later in pregnancy, which is quite ironic for a cohort of folks who want to limit abortion later in pregnancy.
Thank you. Ms. Box, I want to end with you, and I'm so sorry for your loss, but I know you're overjoyed in your daughter that you brought with you. You received test results that revealed your daughter Libby had a chromosomal anomaly when you were around 13 weeks pregnant. If HB 126, the Missouri law that would ban abortion after about 8 weeks, had been the law in the state of Missouri at that time, would you have considered leaving the state to have an abortion? How difficult would it have been for you and your family if you had needed to travel out of state to obtain your abortion care?
So the answer is yes, I would have looked at how I could have protected my daughter regardless of what regulations the state tried to interfere with. The truth is, even though abortion, the ban had not come into effect yet, the 8-week ban, we did look at leaving Missouri and going to Representative Kelly's state of Illinois because the restrictions there are fewer. There is not
The gentlewoman's time has expired. If you could please wrap up real quick.
Yep. So, yes, we would have done whatever we could to protect our daughter regardless of governmental intrusion.
Thank you for sharing your personal story, and I yield back the balance of my time.
I now recognize Representative Green.
Thank you, Madam Chairwoman. My first question is for Dr. McNicholas. Am I pronouncing that correctly? Yeah. If the DNA from a fetus and a mother were found at, say, a crime scene, say it's 2 blood samples, we take fetal blood, we take mother's blood, we put them at the crime scene, the investigators know nothing, they find 2 samples, Would the investigators see these as two separate people?
I have no idea.
Of course they would. The answer is yes. You know, as a physician, it's two different DNAs, and they'd see two DNAs, and so they'd say it's two people. My next question for you as well. Recently in California, a mother was charged for killing her unborn baby by excessive methamphetamine usage. If the mother had just gotten an abortion and killed the baby that way, she wouldn't have been charged. Do you see the hypocrisy in this?
I think it's tragic that we're criminalizing people who need basic health care and treatment for their drug addiction problem. That's what I think is the problem in this case.
Absolutely. Someone who uses methamphetamine should get help. There's no doubt about it. And she was charged with a crime for the death that she caused of her baby with the methamphetamine use. The child was stillborn. I find that hypocritical that if she had just gone a week prior to Planned Parenthood and gotten an abortion, she wouldn't be charged. You know, I'm going to transition a little bit here. I want people to make their own choices. I'm for freedom, but when one person's freedom impinges on the freedom of another, and for example, if someone in this room yelled fire, that'd be against the law, because potentially a stampede could occur and people would be hurt. Abortion is a decision where one person makes it, and it leads to the death of another person. So that's something to take into consideration. My next question I was going to actually ask of Ms. Stuckey, but she's gone. I'll just read the question and let the audience and the others consider it. A few years ago, a freezer unit protecting previously fertilized human eggs, meaning a sperm and ovum, where they had combined to form a fertilized egg, was broken, and thousands of these fertilized eggs were lost. I just want to ask people in the room whether or not they would agree with the headline in the newspaper the following day that said it was a human tragedy that these lives were lost. Just consider that. My next question again is back to you, Dr. McNicholas. In regards to ABO and RH incompatibility, why do I, as an ER physician, have to treat the mothers with RhoGAM to prevent her antibodies from attacking the blood supply of the baby?
Oh, so 2 minutes for this.
No, you got 30 seconds.
Oh.
Or I can do it, because I do it all. I treat these patients all the time. Go ahead.
Sure. So in the instance in which the fetus has a different blood type than mom, there are occasions where mom can create her own defense mechanism to that situation, which would, in a subsequent pregnancy, attack a subsequent pregnancy and have some serious conditions for the fetus.
That was pretty good, and I mean, you did it in about 30 seconds, but she's absolutely correct. Basically, the mother's immune system sees that second child as foreign and attacks it because it's got a different blood type than the mother. Let's see. I also want to share a few quick observations in the little bit of time that I have left as an ER physician. I know that there are a lot of statements about the safety of abortion. I just want to tell you that I have treated many, many patients in the emergency department where the abortion hasn't gone as intended, where products of conception, the medical term, or baby parts are left inside the mother, and sepsis results. And those patients come to us, and we take care of them in the emergency department. We save their life from that infection. I also want to say that I've taken care of many over the years as an emergency medicine physician patients who've come in bleeding from an abortion. And the unfortunate thing is that the obstetrician who has to take care of that patient didn't do the abortion, so he doesn't know the patient's history, and they're rushing them into surgery to stop the bleeding and save the patient's life. That does happen, and it happens more frequently than many people would want you to know, but it is a reality. And I just want to say that's why I support abortion providers having credentials at a hospital where they can treat the complications of the surgical procedure of an abortion that results when they do that. Oh, am I out? Okay, thank you, Madam Chairwoman. Thank you.
Thank you. I'd now like to recognize Congressman Raskin.
Madam Chair, thank you, and thank you for calling this important hearing. Big Brother seems to have come to Missouri. The Leviathan state has arrived in Missouri, and all of our colleagues who like to strike a libertarian note when it comes to people possessing AR-15s and military-style assault weapons, the kinds that are wreaking havoc across the land, suddenly become the champions of Leviathan, Big Brother, Gilead, and the all-powerful state, politicians making health care choices for our people. Ms. Goss-Graves, let me start with you. You're the president of the National Women's Law Center. Presumably you know something about the history of sterilization in our country, where certainly tens of thousands of women at least were sterilized. If government has the power to prevent a woman from having an abortion against her will, won't government also have the power to sterilize women against their will, which was so much a part of our history?
You know, I think it's important to put the right to abortion, which is so core and fundamental, in the context of a range of rights. The right to abortion is in the context of the right to make reproductive health care decisions broadly, including contraception, including around sterilization and not having forced sterilization, but it is also among the set of rights around the right to be intimate, the right to marry. All of those things follow a long line of decisions that animate from the 14th Amendment's guarantee around liberty and around your ability to sort of live with dignity.
Dr. McNicholas, officials in Missouri, including Dr. Randall Williams, the director of the Department of Health and Senior Services, and Governor Parsons, have asserted that the restrictions adopted in Missouri are necessary for the health and safety of people seeking abortions. In your opinion, is the requirement that a physician have admitting privileges at a local hospital necessary for the health or safety of a woman seeking an abortion?
So the short answer is no, and the longer answer is it's not my opinion. It is what science and fact and ACOG and the most recent publication out of the National Academies of Science has told us.
Well, what about this 72-hour waiting period between a woman seeking an abortion and being able to get one? And then also I understand they adopted a provision for 2 pelvic exams during that time. Is that necessary for the health and safety of women in Missouri?
None of those are required to maintain health and safety.
But how do you know that?
Science. There is plenty of published literature supported by the American College of OBGYN, again, supported by the National Academies publication, that has demonstrated that not only are they not medically relevant or necessary, but they actually cause harm.
Well, what about from the standpoint of the patient? Ms. Box, let me come to you. Did you feel that any of the procedural hurdles and hoops that were set up in Missouri and you were forced to jump through were necessary for your health and safety?
No, I found them insulting. They presumed that my husband and I didn't have the ability to make a decision for ourselves. The waiting period that Dr. McNicholas was talking about and the mandatory same physician rule meant that my abortion, which happened at around 15 weeks, had I not been able to do the available date that the physician had, I actually would have been outside of when the legal time frame in Missouri, and I was well short of it. I would have had to reconsent, been given another booklet of medically inaccurate information, which my husband and I refer to as the Book of Shame. And that, all of that presumes that, and I think what I find most insulting as a patient is that I didn't have the ability to think for myself, that I needed my state government to put that time in for me.
But I thank you for that really important insight when you talk about this Book of Shame. I think you started your testimony by saying that 1/4 of American women will have an abortion over the course of their lifetime. Most of them also mothers, as you are. You have how many kids? 2 kids?
I have 3 living children.
You have 3 living children, okay. Well, they want to throw the Book of Shame at tens of millions of American women. How does that feel to you as a citizen in Missouri? You get hit by the Book of Shame.
I mean, it's devastating. I mean, in our particular case, we were in the middle of a very grief-stricken process, and we were in a crisis. And to have confusing and misleading information when you're trying to make a medical decision is horrifying that we would ever allow patients to get mischaracterization and misinformation and hope they can make the best decision for themselves.
Okay, and finally, I wanted to ask this question while all the witnesses were there. I was thinking we could make history by getting the pro-choice witnesses and the anti-choice witnesses to agree on a pro-life program, which is a universal criminal and mental background check on all gun purchases. At least for the witnesses who are still here, would you reach across the aisle to the pro-life witnesses to say you would stand for that? I'd let the record reflect, I think they all nodded their heads, Madam Chair.
Congressman Conley.
Thank you, Madam Chairman, and thank you for holding this hearing, and thank you, Mr. Clay, for being our inspiration in highlighting what's happening in your state. I think we need to be honest here. Everything designed to make your very difficult decision, personal decision, not a state decision, Ms. Box, was designed to take away your choice. What Mr. Green described was insidious logic. Because there might have been complications from some abortions, all abortions should be eliminated. Even though the overwhelming majority of legal abortions, because of Roe v. Wade, are done under medically supervised conditions and are safe and allow women and families to have choices. The changes in Title X are designed, again, to take away or limit choices. The attack on Planned Parenthood, insidious, designed to take away choices, and being willing to deny women health care as the price you have to pay for their ideological stance. And Ms. Stuckey's misguided moral absolutism for all the rest of us. And of course, the sacrifice of science, as you point out, Dr. McNicholas. That has to be in there too, because science is an inconvenient source of information and truth. Again, denied you and your family, Ms. Box, at a critical moment in a decision you had to make. Go ahead. I thought you wanted to comment. All right. Dr. McNicholas, how many women, patients, does Planned Parenthood see every year?
The Planned Parenthood in the St. Louis region, so...
No, nationwide.
Oh, I don't know.
All right, St. Louis.
Our Missouri affiliates see more than about 50,000 women a year.
How many?
50,000.
Would you guess that's a lot more than Dr. Green sees in a year?
It is, and I would actually like to highlight to Dr. Green's point about safety that I have yet to see an oral surgeon be brought in front of Congress to talk about the risks of wisdom teeth, but having an abortion is safer than having your wisdom teeth removed. And so I think mischaracterizing abortion as anything other than safe is inappropriate. It's healthcare. So yes, unfortunate outcomes will happen for some people, but by and large, it is safer than colonoscopy, wisdom teeth, and I will also mention it is far safer than carrying a pregnancy to term.
And it's safe because Roe v. Wade made one law for the whole United States, including Missouri. Is that correct?
We have lots of examples internationally to show that legalization of abortion is one of the most important public health and life-saving interventions for women.
And would it be fair to say that absent Roe v. Wade, it's not that abortion will disappear. It is that people will be forced once again to go into the shadows to secure those services, to make those decisions, or go to states that do protect it legally. Is that a fair statement?
So as I mentioned before, abortion was around before the Constitution, and it will not go anywhere if we remove those barriers.
So our choices make it safe. Hopefully it's rare because contraception is available, family planning is available, but it has to be an option, as Ms. Box's personal experience tells us. It's a health decision, a hard one, a heartbreaking one for many people. But to deny them access to it because you've decided on the morality of it, or you've made up science to justify your own personal beliefs, is to impose your will on the majority of Americans, including women who are affected by this choice. Title X, Dr. McNicholas. Planned Parenthood decided to pull out of Title X, even though it does not provide funding for abortions. Is that correct?
That's correct.
Why did Planned Parenthood decide to leave Title X?
I think, as was previously mentioned by Ms. Goss-Graves, there's a really fundamental issue for Planned Parenthood, which is that the new rule would force us to lie to patients and intentionally exclude information that could be important and life-saving for them.
And real quickly, because Title X provides other health care for women, they're now going to be denied that coverage because of Planned Parenthood's being forced out of the program. Is that correct?
We are going to try our very best to meet all of the needs of our patients, including those who were previously receiving Title X, but I think the point is well taken that with reduction of Planned Parenthood seeing Title X patients, there will be a tremendous gap in services for patients, particularly who are low income or people of color.
My time has expired, but I thank you all for being here and for the courage of sharing, especially you, Ms. Box.
To recognize Congresswoman Tlaib.
Sorry, I didn't know I was next. Thank you so much. It really is incredibly important that you all are here to talk about this particular issue, especially as a woman serving the United States Congress. I just want to personally thank you for defending my right to choose. One of the things I want to discuss is the impact of politically motivated restrictions of abortion that we've been talking about, access to maternal health, but even more, even around infant mortality. When I served 6 years in the Michigan State Legislature, I was always taken aback by so much time and effort and debate and conversation around the right to choose versus infant mortality, maternal health, all of those things that I think are interconnected with some of the, reasoning behind folks that want to support life, right? And there is an issue that is deeply, concerning to me is that parts of my home district have among the highest maternal mortality rates in the country. In 2014, a woman giving birth in Detroit was 3 times more likely to die in childbirth than the rest of the country. Infant mortality in Detroit is double the national rate in the country. And it just goes on and on. And so, Dr. McNichols, Missouri was one of the highest rates, has the highest rates of maternal mortality in the country, and it continues to rise, especially among women of color. In fact, Black women in Missouri are 3 times more likely to die from pregnancy complications than other women. Is that correct?
That is correct.
Which state official, again, is responsible for addressing maternal mortality in Missouri?
That would be the director of our Department of Public Health, Dr. Randall Williams.
So Dr. Williams is, in fact, the same official that has spent state dollars on enforcing unnecessary pelvic exams on women and tracking their menstrual cycles of Planned Parenthood patients, correct?
Yes.
How do you think that he should be spending time on? I mean, what do you think he should be doing right now? And again, around the same ideals, right, that they're supporting this. Mm-hmm. They won't support the women that are having children.
Mm-hmm. Yeah, you raise a great point. Under Dr. Williams, Missouri went from 42nd in the country to 44th in the country in maternal mortality. And while he's spending his time his time and resources on visiting Planned Parenthood multiple times, he could be focusing on things like addressing maternal mortality, addressing the systemic and institutional racism that is ingrained in that rate of 3 times higher for Black women. He could be working on improving access, particularly for our rural women. Missouri is one of the states who, because we haven't expanded Medicaid, hey, that's another thing he could do. Mm-hmm. We have rural hospitals closing at alarming rates. So if you want to continue your pregnancy, your chance of having a healthy pregnancy is sabotaged by the fact that there's no hospital that you can go to get care during that pregnancy. There are a number of things that he can be doing to address maternal mortality.
I know, the hypocrisy is so unjust and absurd. Ms. Howell, your organization did a phenomenal study, finding that Black women face greater barriers to access to reproductive health care, including abortion care. What are some of the factors that you think account for the discrepancy in health outcomes?
Some of the factors are that Black women are disproportionately get their health insurance from Medicaid, which already then bans their access to abortion care and to get coverage. So what happens is that when they find that they are pregnant and they decide they want to terminate a pregnancy, they have to go through a number of steps. They've got to figure out how to afford it, how they can take off work, how they can get child care, how far they have to travel. One of the things that we did is we asked Black women in a poll, what are all the factors you take into account when you're deciding whether or not to have a child? And it wasn't just about having money. It was also about having a neighborhood where neighborhood services were happening. It was about being able to get quality food sources. It was about clean water. There were a number of factors, and if you are a woman of low income and you get your health care from Medicaid, you also have all these other factors that come into. And that's why when we were talking about no one knowing all the reasons why someone might decide to terminate a pregnancy, our organization trusts Black women to make those personal decisions that are best for themselves and their families. And the other side clearly does not trust us to make those decisions.
No, they want to control us. Thank you so much, and I yield the rest of my time.
I thank my friend from Michigan for her powerful voice for her state. And I now call upon one of Congress's most outstanding leaders, my good friend and colleague Barbara Lee, for her. And I want to publicly thank her for her tireless work and for being such a powerful advocate for progress, gender, justice, and equality. Thank you for sitting here all day long. She's not even a member of the committee, so I really appreciate your being here, and I appreciate your voice.
Well, thank you, Chairwoman Maloney, for holding this hearing and for your tremendous work and leadership, and also for allowing me to sit through this very, very important hearing. I also want to thank my colleagues from the Pro-Choice Caucus, especially our chairs of our task forces, Congresswoman Ayanna Pressley and Congresswoman Judy Chu, who have been such clear-thinking and passionate leaders on so many issues since they have been here in the House of Representatives. First, let me just, and throughout their lives, quite frankly, let me start by just stating a couple of statistics. Banning access to safe, legal abortion is not what the majority of this country wants. According to recent polling published in September, 77% of Americans support access to abortion. And we know and we see how many of these restrictions disproportionately, which we've talked about, impact women of color and low-income women. Access to the full range of reproductive health care should be accessible to all and not based on one's race, income, or zip code. Now, fighting for equitable access to abortion is deeply personal for me, and I do, and it's hard to talk about this, but I think today, you know, I'll mention it again, I remember very clearly the days of back alley abortions before Roe versus Wade. I was a teenager, only 16 years old, and had to go to Mexico for a gut-wrenching back alley abortion. Again, before Roe versus Wade. Abortions were not safe nor legal in my own country. So I refuse to stand by and see even one more woman's life put in danger because of lack of access to safe and legal abortions. Now, many of my Republican colleagues here today and the minority witness, they want to portray women who have had abortions as evil or as murderers. But I'm here today with several of my sisters, several who have personally had an abortion. And when you say these comments, they also say them to me, they say them to you, and we're not going to stand for it. Many, and I serve on the Appropriations Committee, and let me tell you what I see. Many of my Republican colleagues, they oppose teen pregnancy prevention programs. They oppose comprehensive sex education. They oppose family planning. They oppose contraception. They oppose abortions. Again, as an appropriator, I see these budgets zeroing out funding for health care programs that would prevent pregnancies. Also, I see budget cuts every day to child care, SNAP benefits, nutrition, early childhood education, everything that would help raise families and children in a way that they deserve to be raised. So I want to just ask you your feedback. Maybe, Ms. Howell, could you just, we know that these programs are disproportionately impacting women of color. And how do you see this whole movement now and what we're seeing? I still call it a war on women's health, because when you look at the comprehensive nature of these cuts and the policies and the restrictions, what else is it? What are we to do as women in this country?
I think that one of the things that we've seen over the last couple of years is women taking back their rights. Women, and it's not just women, it's people, it's LGBTQ people, it's trans people, basically standing up and saying, we won't allow this to happen anymore. And we saw it in the 2018 election. We saw it where women of color, for instance, came out and voted to change the House of Representatives, voted very strongly. And one of those issues that they voted on was Hyde, eliminating Hyde and having the Each Woman Act. So they were very clear about what they were looking for and the right to make decisions for themselves without political interference. And I think that that's critical.
Thank you. Ms. Graves, would you like to comment? We have just a few more seconds. I want to thank Ms. Box for your being here today and your stories, and for being so brave in terms of given the real deal about what women go through as a result of trying to exercise their constitutional rights. So thank you. Ms. Graves?
I just want to add that it is true that people are outraged and are rising up against the bans that are sweeping this country, but this is a dangerous time. It is dangerous to ban abortion. It is dangerous to have states where people think they can't get care, even though abortion is legal in every state of this country. And it is dangerous, the rhetoric that we heard in this room today and that we hear outside of this room that demonizes patients, that demonizes women, and that goes sort of to the core of who we are as a country. This today has reminded me how dangerous these times are.
Thank you, Madam Chair, very much.
I want to thank my friend Barbara Lee for sharing really one of the most personal and heartbreaking events of her life. She's sharing it not only at this hearing, but with the whole world. And Barbara Lee, your courage has made us all stronger. Thank you, and your leadership. I now call on an incredible woman, a newly elected woman to our Congress, Congresswoman Kim Schreier. She's from the great state of Washington. She is a physician and a powerful advocate for science and women across this country. Thank you for being here. She's not a member of this committee, but she wanted to be here and to speak out, and I thank you for being here all day, supporting our efforts. Thank you.
Thank you, Madam Chair. I laugh because I thought you were going to talk about Ayanna Pressley, who is a remarkable member of our freshman class.
I already talked about her.
I came here today to talk about these unnecessary restrictions on a woman's access to full reproductive care, access to abortion. And we have heard about a million ways that local governments and state governments are trying to restrict a woman's access to a safe and legal medical procedure. And every one of these unnecessary ultrasounds, bogus scripts, hallway size, admitting privileges at local hospitals, second pelvic exams, even first pelvic exams, admitting privileges I mentioned, and even waiting periods, all of those are unnecessary. They make it harder for women. They especially make it harder for women who are poor, who would have to take additional time off work, who would have to travel great distances. These do not stop abortions. If you want that as your goal, you should be doubling down on funding for Planned Parenthood for pregnancy prevention. These do not stop abortions. They make them later, they delay them, or they make them less safe. They are totally inappropriate. Now, I came to talk about that, and I want to reinforce that this is a safe and legal procedure, something that 1 out of 4 women has before she's 45 years old. This is more common than a tonsillectomy. This is common. Chances are excellent, pretty much 100%, that everybody in this room knows somebody who's had an abortion. That's how common it is. So I came to discuss those things, but then I heard all kinds of rhetoric. And as a doctor, and thank you all for being here, I really feel like I need to push back on a lot of Ms. Stuckey's comments. Pseudoscience, total baloney, and I don't feel like I can let those things just stand. I mean, it's everything from not understanding a difference between an embryo and a baby, which, by the way, if she believes they are the same, that is a personal, philosophical, and religious decision. That is not a medical distinction, and that is not something that Congress should be involved in. It is not something that she should have any say over any other woman's decision. But there are other things that she talked about, like 20 weeks and pain, totally unproven, bogus. She talked about the gag rule not being a gag rule. It is. When a physician cannot mention that one option for her patient is abortion, that is a gag rule. And by the way, it's a dangerous gag rule, because if a woman is diagnosed with pregnancy and cervical cancer at the exact same visit, an abortion would save her life. Let's be clear. The other one she mentioned was she painted a very happy picture of a 23-week micropreemie. I'm a pediatrician. I've spent a lot of time in NICUs. Let me tell you what the real picture is. The real picture is that you've got about a 50-50 shot of survival, and you've got, if you do survive, a very high likelihood of having consequences later down the line. Now, that doesn't mean that I didn't resuscitate those babies and take care of them in the NICU, but it does mean that she is not giving you the full, correct picture of a situation. But the most egregious one is this discussion that somehow you could pull a baby out 3 days before that delivery and call that an abortion. We call that an induced delivery. That is a baby who is pulled out and handed to their mother or taken to the NICU, where a doctor like me would take care of them if they are in trouble or in distress. If you want to have a conversation about pregnancies and abortions later in pregnancy, let's have a really honest discussion about it. About 1% of abortions happen after 20 weeks, and none of these are because a woman just decided one morning, I don't want to be pregnant anymore. That does not happen. These are all for a reason. Something devastating has taken a turn in a pregnancy. Something has happened either with the health of the mother or the health of the pregnancy, and it is so important that Congress not get into that discussion. This is a decision between a woman and her God and her doctor and her life, and only she knows how to make this decision, and there is absolutely no place for me or anybody in Congress to get into that discussion. What we owe that woman is a little grace and a little trust to make the best decision about her body. I will end there. Thank you, and I am sorry that you had to put up with such harassment today. Thank you for your services.
Thank you. I now recognize Mr. Keller.
Thank you, Madam Chair. What I want to start out with is, I heard some testimony during today's hearing about the viability of a pregnancy being difficult to determine because they're all based on a different diagnosis, different situation. And I'll get to that later in my comments. I just want to start out with knowing that, and I know that it was just mentioned that some babies have a 50-50 shot of survival. Dr. Schreier mentioned that. I just want to say this: every life has opportunity and hope, and sometimes doctors, despite their best efforts, do not calculate the appropriate outcome for their diagnosis. I've had a personal experience with this. When my son Freddie was 3 years old, he had an injury resulted in led to a devastating head injury. He had an accident. The doctors, despite their best efforts, thought Freddie was not going to live. He was put on life support. As we waited and prayed, the doctor's prognosis was that the mortality rate of children in his condition was not 50%, was not 98%, but we were told was 100%. He was not going to live. They even tried to convince us to disconnect life support and end his treatment since they did not believe he was going to live. He was on a vent for 28 days. We chose life, we chose hope. And Freddie started to recover. Even then, the doctors said he would have permanent brain damage and would not have a meaningful or full life. I'm happy to say that today, Freddie has fully recovered. Freddie's outcome was different. He graduated from college and now works for the hospital that saved his life. It was a different outcome than what the doctors told us it would be. His accident is now a memory, but also an opportunity to learn about the value of human life. As this pertains to today's hearing, in this country, we have countless situations where people determine the value of an unborn human life. Abortions are sometimes planned and executed based upon diagnoses that have uncertain outcomes. Sometimes as a result, babies are born, they're alive, and they are killed as part of a planned abortion procedure. This should not only shock the conscience, but should make the American people sick. I'm not asking for an answer to the next question I'm going to ask. I'm just going to leave it up to the people that are watching. But where does it stop when we have people determining the value of human life? I yield back.
Would you yield to me?
I yield to Dr. Fox.
Thank you, Mr. Keller. Mr. Keller, thank you for that moving story about Freddie. I think you illustrated something very important to us. Doctors can make predictions, but they're not God, and they don't know what's going to happen. We've heard a lot of things here today, but I could not let this hearing close without saying that there are many things we've heard that should make us shudder, but I believe that what Mr. Keller said leads us into what I want to say next. But comparing killing a baby to removing wisdom teeth is absolutely beyond the pale. And when we have people, as Mr. Keller asked the question, where is this decision to kill innocent life going to take us in this country? To say it's terminating a pregnancy, and as Ms. Stuckey said, never, ever facing up to what you're really doing is scary to me. And I want to say that Ms. Lee said that Republicans characterize women who've had an abortion as evil. I've never heard a Republican say that. We grieve, and I said that at the beginning, we grieve for the women who find themselves making that decision. I cannot imagine that it's ever easy. I hope it's never easy for any woman to decide to kill her unborn child. I hope and pray that's not easy. And I would never characterize a woman who's faced with that decision and makes that decision as evil. Thank you, Madam Chair.
I thank the gentleman. She yields back, and I yield myself 5 minutes. And this hearing is very important to me and very meaningful, because usually when I'm attending a hearing on women's health care and women's needs, I'm talking to an all-male panel and usually have to ask, where are the women, especially on hearings that affect their well-being and their health care. It is personally thrilling and inspiring to me to see a panel made entirely of women's voices, and America should listen to women's voices. I want to thank all of the panelists, but I particularly want to thank Mrs. Box. I believe that your voice is the most important of all the important voices that we have heard today, because to me, you represent every person who's been shamed and judged for making a deeply personal decision about their own body and their own health care, and for them wanting to access the very best health care that they need to take care of themselves and their families. I just want to ask you, Mrs. Box, and I know it's difficult to testify before Congress on anything, but especially something that has been so personal. How did it feel to hear officials in your state and across the country say hateful rhetoric about the decision that you were making, your own personal decision? How did it feel?
It's insulting, and I appreciate Representative Fox's sympathy for me, but I would like to say that while my particular reason for abortion and fetal diagnosis was sad for our family, most women, including myself, not all, but most, experience relief after having an abortion. And I said in my, I think when I answered a question, that our abortion, it was the first day that we began to heal from the grief of our diagnosis. I have cried a lot of tears about Libby, but they have all been in grieving my daughter and never once in regret for my decision to make a medical choice for her as her parent. And, you know, I also wanted to say, I'm sorry, sir, I can't see your name, but I'm really glad that your son had a positive outcome, and I believe in supporting parents in making the best decisions for their family and their children, and that's what my husband and I did for Libby.
Thank you for sharing your experience. Dr. McNicholas, you've cared for hundreds of patients in Mrs. Bach's situation. What impacts have you seen on the patients you care for in Missouri as these restrictive laws are enacted and forced upon them?
So I think, first and foremost, the outright confusion that people have about what's happening in terms of their access to abortion and reproductive care more broadly is really important to lift up. As abortion bans are passed, whether they're enacted or not, patients automatically think that means they can't access abortion. So we have done a tremendous amount of work in patient reassurance and making sure that the country knows that abortion is still legal in every single state in this country.
What are you most worried about for your patients?
I worry that they have the realization, the full realization, that the people who are charged with protecting their health have completely abdicated their responsibility based on an ideologic viewpoint. 100% people who don't believe in abortion choosing not to have one. But I also think it is the right of every other individual to make that choice based on their values.
I thank you really for the courage that all of you have in your work and what you've done for other women and for our country. I want to share that I have within my district 2 Planned Parenthood centers. And if you go to them at the end of the day, when women are getting off of work, women are lined up through the halls of the building, outside to the sidewalk, down the street, into the next block, waiting to get basic health care services. And Planned Parenthood centers provide primary and preventive health care to many who otherwise would have nowhere else to turn for care. And I want to point out that 54% of Planned Parenthood centers are in areas where there's health care shortages. And we have heard testimony from medical experts that if Planned Parenthood is defunded, there is no other health facility that can address these needs and help these women. I cannot tell you how many women come to my office and tell me that at certain times in their life, the only place they could get health care was Planned Parenthood. And I want to put that on the record, that I think it's a scandal that anyone would ever try to defund a service that is providing so much help to people that need it. This has been an important hearing to me, and I intend to continue working on this area and helping women receive the respect and the health care they deserve. I would now like to call on my good friend, Jackie Spear, and give her 5 minutes and thank her for her relentless leadership in support of women's issues and women.
Thank you, Madam Chair, and thank you to a remarkable panel of very persuasive and committed women to the service of other women. Ms. Box, when you testified earlier, I was sitting here and I started to cry because I share the same experience that you have had. I lost a child, a fetus, when I was 17 weeks. And I told my story on the House floor, in part because I sat there and listened to such false information coming from my colleagues on the other side of the aisle, that it outraged me so much that I said, you have no idea what you're talking about. You have not lived through this kind of experience. And to hear you talk about Libby Rose and keep her on your chest is just very powerful, because it underscores what we all go through when we lose a fetus at late term. It is never by choice. And I find it so offensive that we continue to have members here in Congress think that they can somehow take hold of our bodies and tell us what we can do. So thank you. Thank you for your presence here, for your new infant's presence here. Having the gurgling of your child was just music to all of our ears. And thank you to all of you as well. I'm going to share one story, though, that relates to Missouri. My daughter went to the University of Missouri and graduated there. She had a girlfriend who became pregnant, who then drove an hour and a half to St. Louis to be seen, and then was told that she had to wait 3 days, and so then she had to drive an hour and a half back. And then, of course, she couldn't get the abortion in 3 days because there was such a long waiting list. Now, this friend of my daughter's then finally called her mother, who lived in another state, who was not pro-choice. And her mother came and picked her up and took her to another state to get the abortion. We cannot force women to have to jump through hoops and travel long distances to get the health care that they deserve and that is legal under the law in this country. And to see what Missouri has done with their laws and how difficult they have made it is so repugnant to me and should be repugnant to every woman in this country. Now, Ms. Box, let me ask you the question that I think about a lot. When you were required to wait your 72 hours and receive this counseling, what was the counseling that you received?
Well, first, I want to say that I thank you for sharing your story with me, and I am sorry for your loss. I know how painful that is. I'm not the legal expert, but we don't really have, is it counseling?
You didn't recognize it as counseling.
Oh, okay. I'm sorry, yeah, you're right. I didn't understand that was considered counseling.
What was it?
It's a booklet that has, so the consent process, I guess, is that, I apologize. So they had to go over this information, and they provided me with a booklet that is written by the state that has medically inaccurate information in an attempt to help me make an informed decision, which just doesn't make sense to me. But what I will say is that how it works in Missouri currently is that you have to consent with the provider who will perform the abortion. And so my consent and my counseling, the book, like I said earlier, I call a book of shame. But my conversation with the provider, with the doctor who works at Planned Parenthood, was the most compassionate care I have ever received. She took something that was the worst experience of my husband in my life and showed us love and no judgment and counseled us in all of the options available to us and gave us medically accurate, science-based information so that we could make a decision as parents that was informed and full of love.
Thank you. Thank you again, all of you, and I yield back.
Thank you.
Thank you. Thank you so much. I would like to enter into the record a series of letters that the committee has received in recent days from organizations, including the American College of Obstetricians and Gynecologists, Repro Action, the Guttmacher Institute, and the American Civil Liberties Union. These letters express grave concern over the impact that state restrictions on abortion access are having on the health, economic well-being of women in America and their families. I ask unanimous consent that these letters be entered into the official hearing record, and I so order. I'd like now to thank our incredible witnesses for testifying and for their life's work. And without objection, all members will have 5 legislative days within which to submit additional written questions for the witnesses to the chair, which will be forwarded to the witnesses for their response. I ask our witnesses to please respond as promptly as possible, and this hearing is now, but before I conclude this hearing, I would like to thank the powerful women of this committee, especially Ms. Spire, Ms. Presley, Ms. Kelly, Ms. Ocasio-Cortez, for their leadership on this issue and for encouraging the committee to examine it. I would also like to thank Congresswoman Judy Chu, Congresswoman Jan Schakowsky, Congresswoman Barbara Lee, and Congresswoman Kim Schreier for joining us this afternoon and for their tireless work to preserve access to abortion and reproductive health care for women across this nation. And I would also like to thank Lacey Clay, who has worked with me on this hearing and for his leadership on this issue. This hearing is adjourned, but we're going to continue on this issue. Thank you. Wow. Let's go down there and hug.